Neil deGrasse Tyson is with us. He's a leading astrophysicist. Neil deGrasse Tyson is with us. He's a leading astrophysicist. All right, welcome everybody. We are standing by 23 minutes away from a Donald Trump press conference during which he will announce, unless something changes, a national emergency around coronavirus, COVID-19. And of course, this is likely to do two things. It is likely to cause more panic, hoarding of toilet paper and 50-pound containers of rice and the like. But hopefully, it will also get enough people taking this seriously because a lot of what's going on is just math. And if we don't get people self isolating and staying away from others until such time that there's time to test antivirals, I have news about that. Until, it's going to be months at minimum, maybe a vaccine can be developed. There's really nothing else that can be done until that time. And we have to stop the spread. There are some countries that have done it successfully. Eventually, with extreme authoritarian measures, we're going to be looking at those numbers. I have a whole bunch of different stuff to look at, maybe some before and maybe some after Donald Trump's speech expected at the top of the hour. And then, of course, remember that so many people who insisted that this was nothing and this is all, the Brazilian president now has coronavirus after almost laughing it off just days ago. There's probably a 35% chance, I would estimate, that Donald Trump himself has it. You might remember he didn't look well during his announcement, his address on Wednesday night. That right eye was swollen almost completely shut, even more labored breathing than usual. Who knows? There are worst case estimates that 150 million Americans, or about 1 in 3, will eventually have this. And we are going to simply have to wait and see and do what we can do. Information, that there's not only a viral spread of the virus, there's also a viral spread of misinformation. Everything from black people are naturally immune to drink a bleach concoction to cure it, all the way to there is testing. I mean, part of the disinformation, shockingly, is coming from the president himself. And maybe we will even pull up, while we have a little time here, I'll pull up, I tweeted this list earlier. I've been tweeting a lot of different stuff today, much of which we're going to discuss. Where was it? The list. Sorry for the fast scroll. Here's a list of lies told so far. And this is very small. I don't expect people to be able to read it, but it's a dated list of the lies that our own administration has been spreading and perpetuating. And it's really, really bad. Consider retweeting this. I think that it is definitely of some value to understand the degree to which even our own administration is telling us things that are untrue. Not drinking bleach, by the way, drinking chai tea. As far as what we're doing at the David Pakman Show, we are basically moving into a work from home scenario over the weekend, and already we're going to start mobilizing technical resources. We're going to basically disaggregate and decentralize the production of the show, and I'm going to be filming from home. We are going to be doing, cutting clips from home. Pat may briefly spend some time in at the office. Our building is not closed in any way, but far fewer people that are going in. And, some people wrote to me and said, David, it seems like you're overreacting. Well, the whole point is we don't want to be behind the curve. And if we're in an office with hundreds of other people who rent space in the building, we may be sick and not know it. Listen, I think it's possible I have the virus. It's remotely possible. 10 days ago, I had just the slightest cough and no other symptoms. And I've read you can have basically almost nothing for 2 weeks. It's conceivable that I've had it for 10 days. And in 3 days, I am going to experience some new symptom. We just don't know. People aren't being tested. And so I am, out of an abundance of caution, I'm also going to be sort of self-quarantining to the degree that is possible. So I don't know what else. I do want to mention, by the way, one of the big horrible things that has been going on is that YouTube flatly demonetized all coronavirus content, dubbing it a sensitive issue, an issue of it's sort of like a localized sensitive issue that's not brand safe. I have been notified, and this hasn't happened yet, but I've been notified that YouTube is going to be whitelisting some channels that they have determined are authoritative sources, not disseminators of disinformation on coronavirus, and they will be whitelisted for monetization on coronavirus content. And I've been told we are one of those channels. And this is a very small group of channels. So we're taking this very seriously. We've been reporting on this for months at this point in time. I know many of you know that, and we're going to continue doing that. And it is important that the channels that you believe are helping to not escalate panic and also reporting things as they are, support those channels. It doesn't have to be this one, but there is a small group of us. And I've been told that the David Pakman Show YouTube channel, which, as you know, has over 800,000 subscribers, and we're taking this seriously. There's a responsibility associated here. I'm told that we are going to be whitelisted, and it is a really big move. Excuse me, just having my chai tea. Okay, so we're about 17 minutes. We may watch this on the PBS channel. My guess is that the White House channel may have a live stream coming up soon as well, although I am not seeing it yet. So we will see that. Let me answer some super chats. Oh, let me just do things in order. We have plenty of time to talk about what's going on. Okay, on Twitch, let me say thank you to Dem0Cool for the subscription. Oceanova says, hey, David, are you having any shortness of breath? No shortness of breath right now. Chris Rads subscribed with Prime. Perturba08 subscribed with Prime, says Trump would definitely be a high-risk patient. He is obese, old, and not in good shape. And Comstock Rocker has also gifted a subscription. I very much appreciate that. I also want to say thank you to Manraj Baines, who has just subscribed at joinpacman.com, taking advantage of the coupon code you see right above my head, 2020 now. That does save you 66%. And I really appreciate all the people that have been supporting our channel and our continued coverage. You know, when we first learned all coronavirus content was demonetized 2.5 months ago, when we started covering this, we said, we don't care, we're going to keep covering this because this is clearly becoming a bigger and bigger thing. And we've continued to cover it. We've just been notified we are going to be whitelisted as an authoritative source on the issue by YouTube by next Monday. That's a big deal, but we've been covering it the entire time because it is so important. Okay, super chats coming in. We're just waiting for Trump at the top of the hour. Dan Stupka says, how can I immediately buy some short sales? The second he opens his mouth, the market is going to crash even more. Yeah, so we are watching that. Here is the stock market. As you can see, it's been an up and down day, down to almost, let's actually get the intraday just because that's better. One day. Here we go. So the markets opened significantly higher, 6% higher. They got down all the way to being only up 1/4 of a point. We're now back up to being up 2.87%. I hope this doesn't happen, but I worry as soon as Donald Trump declares a national emergency in 20 minutes, the stock market will again implode, and it will be very bad for a lot of people's retirement accounts. So we're all just waiting to see. Dutch Morgan says, if Bernie won the nomination and went against Trump, do you think Bernie would say Trump is his friend and is electable? I have no idea. We are seeing, by the way, I did also put out a tweet a few minutes ago. Let me get this on screen. I'm managing a bunch of different things I want to go over with you guys. I said, I guess it's time to ask, do any of my followers think Trump will use today's national emergency declaration combined with something else forthcoming to try to delay the November election? A national emergency, I am not conspiratorial in this way, but I'm asking you the question. What do you think about it? And you can let me know on Twitter if you want, or send me a message otherwise, and we can explore that possibility. I believe the Louisiana primary has been delayed by, it's either 2 weeks or 2 months. Who knows? I mean, again, we're trying to keep up with the spread of information ourselves. Let's see here. Matt Bond says the Australian Minister of Home Affairs positioned for COVID-19 and was with Trump, Barbie Trump and Bill Barbie last week. The Don got 3 up close and personal so far. Yeah, Trump's been exposed to a whole bunch of people that either have or are suspected of having the virus. Inconsolable says, can't wait for another miscommunication that results in the further collapse of our national economy. Yeah, I mean, look, consider the number of lies that Donald Trump told, and we're just monitoring whether the White House is going to have a stream as well. Otherwise, we'll pick it up directly from PBS, which is safe as far as we know. Trump's Wednesday night address included three major sources of disinformation. One was saying European travel is just shut down. The truth is, it doesn't even apply to American citizens and residents. You can go back and forth. You may be quarantined. It's unclear, but really, we're talking about foreign nationals. Number two, Trump said it applied to trade and cargo. It didn't. And number three, Trump said insurance companies were waiving all copays for coronavirus treatment. That was untrue. They were waiving at the time copays for coronavirus testing. In Massachusetts, our Republican governor is actually not handling this poorly. Charlie Baker. He has been involved in getting Massachusetts insurers to actually waive copays on treatment, which really is a big deal. And again, Trump was reading a teleprompter, meaning someone put the lies or the disinformation on the prompter, which is absolutely insane. Let me say thank you to Adam Adrian. Adam Adrian is new member number 2 today on my website at joinpacman.com. I really appreciate, we've been working very hard to continue the flow of coronavirus information and keep everybody up to speed. We are decentralizing our production of the show, which is going to involve a bunch of different costs, but I'm doing it because I want to be ahead of the curve instead of behind it. And I really appreciate everybody who's been supporting the streams and our work. Let me say thank you to Wes Smoke for the super chat. Inconsolable says Seattle is in serious trouble. Restaurants and businesses closing, people losing jobs, not being able to pay rent. It will take years to recover. I believe that that is true. I believe that that is exactly right. Ori Apoj says, David, thanks for your honest and level-headed news. Thank you. Thanks to Michael Hag for the super chat. Kevin Shane, hey, David, your coverage has been indispensable on this. Only thing I'd say is watch your wording on what exactly the Fed relief means. Great work. Thanks to Schroem for grabbing a Soy Boy membership. Aaron Washington says, if you think the coronavirus is bad, let us not forget about all of the ancient diseases and illnesses that are trapped within the melting ice due to climate change. I don't know anything about that scientifically, so I'm not going to, I don't want to spread any information that could be inaccurate. I can't comment on that. Thanks to David Garrett for grabbing a Soy Boy membership. Alien P says, hello from Germany, David. Keep up the work. D. Cosby, this is starting to feel like Stephen King's The Stand. Look out for Captain Trips. It is feeling dystopian. I'm not going to lie. It is feeling very, very dystopian. David Garrett has upgraded his membership to a beta membership. Thank you. I appreciate that as well. Thank you also to Jinsin on Twitch for grabbing a Twitch Prime subscription. Are people saying that the stocks are already starting to tank? Just this tiny bit. It doesn't see. It actually went up and then down while we were. Listen, if there's going to be a big move, it's going to come when Donald Trump speaks at the top of the hour. We're just about 10 minutes from that, and we are standing by for the White House feed. And if we can't get that feed, oh, here it is. Here's the White House feed. Very good. All right, so we've got the White House feed ready to go, and this is going to start momentarily. Okay, I have so much stuff to go through with you guys. I don't even really know where to start. Just a couple of things. And, Donald Trump doesn't really understand this stuff at a deep level, so you're not going to get any of this for him. Here's the type of question that is going to be a societal question. So I want to be really clear about something. I am not going to come up with any theories of my own about the coronavirus thing. It's just too serious and it's irresponsible. So you're not going to hear me talking about what if this is some kind of weaponized thing or any of this stuff. I will report to you disinformation and what experts are saying. One of the things scientists are talking about is, what are we going to do, for example, if presented with a possible vaccine, which normally would go through animal testing? This is an article on Live Science about researchers who are essentially ready and already recruiting, as this article says. A clinical trial for an experimental coronavirus vaccine has begun recruiting participants in Seattle, but researchers did not first show that the vaccine triggered an immune response in animals as normally required. I tweeted about this, and you can respond to me on Twitter. Is this getting so bad that there is a case to be made for skipping the animal trials and going right to human testing, or not? What is the parameter that would be used to determine whether it is or is not appropriate? I don't even pretend to have the answer on any of this stuff. What I'm bringing to you is, this is the type of thing that's going on. If you do a news search for coronavirus vaccine, you will see that there are multiple vaccines that are essentially ready for testing on humans. except for the fact that they've not been tested on animals yet. What do? I don't pretend to have the answer. I'm merely telling you that this is something that is being explored. Number two, if you Google, I've been keeping up with this daily, coronavirus antiviral. Okay, there is a drug from an Israeli pharmaceutical company, remdesivir. Remdesivir. I'm not exactly sure how it's pronounced. This was developed potentially for use against Ebola, and it didn't work against Ebola. There is the idea, again, some experts are optimistic that it or something similar could work on COVID-19. I would be following this very, very closely. But again, we have to remember that imagine that testing is done and this is a good thing. We are going to have a supply problem because we are soon going to have, we don't have 100,000 active cases yet. Right now, the number of active cases is 66,000. But as you can see, the number of active cases after declining from about mid-February to early March is now rising dramatically. We are going to need, if a lab can get 1,000 of these, we're going to need 100,000 of these. So this is a drug. I would encourage you to Google this. This is an article from Scientific American as well. The potential of antivirals. Remdesivir is the one that has potential at this point in time, and that's all it is. All it is potential. Let me say thanks over on Twitch to Cyberpath, RJCA, and Ladoifin for sending bits and subscribing. I also want to say thank you to Corey Fellows, who's new member number 3 on my website, joinpacman.com. Harry Alden is new member number 4 at joinpacman.com. And also, is that everybody? Oh, and Dan Stupka is new member number 5 at joinpacman.com. Really appreciate that. Support of any kind is much appreciated. Okay, other super chats that are coming in. Let's see here. Okay, Per Tiran. Hey, Per, great to see you. The doctor I mentioned earlier is called John Campbell. Sorry that I didn't check first. Yeah, if somebody wants, so this, I'm not going to recommend anything that's bells and whistles. Okay. Every day, sometimes twice a day, Dr. John Campbell, who I believe is a British doctor, is looking through all of the news of the day related to coronavirus and giving people an update and evaluating what's going on in very simple terms. I highly recommend Dr. John Campbell's channel. Jackson Hanan says, I used to say that it would take something catastrophic like Trump saying the N-word for Democrats to win Senate seats in South Carolina, Alaska, and Kentucky. I think something catastrophic is happening. Yeah, there are a lot of polls that are looking very good for some Democratic challengers in the Senate in this coming November 2020 election cycle. Brian Campbell says Bernie said COVID-19 will show our healthcare system flaws. That's an understatement. Thanks to Melissa K for the YouTube subscription. ABBC Now Taekwondo says, could coronavirus be bacterial and not viral? I think the medical community would know that at this point. I believe that they are right, that everything I've read is that it is viral and that it is a virus. That seems very clear. Kevin Altschuler says, aren't you worried that COVID will shut down the porn industry? Very worried, extremely worried. Santa Claus says rats will often have a different immune system response to vaccinations than humans, which could prolong the clinical trial testing, but without the rats, the risk could increase. No good answer here. It's a difficult situation. Jay Harper, what policy proposals do you like from Joe Biden? Well, do I like them better than Trump's? I mean, Biden's tax plan's better than Trump's. Biden on his website says he supports the Green New Deal. The question is like compared to what is always the question in politics. Aaron Washington says we shouldn't be torturing other animals for our own benefits to begin with, quite frankly. That's a controversial issue. A lot of people have different perspectives on that. Yeah, guys, the question of whether coronavirus is actually a bacteria and not a virus, it's almost crazy to even suggest that at this point in time. Let me say thanks to Isaac Nixon, who is new member number 6 today. Really appreciate your support, Isaac. I also want to say thank you to Ted Wilson, who's new member number 7 today. If you're just joining us, we are just minutes from Donald Trump's press conference. He is expected to declare a national emergency around coronavirus. The guy who 5 days ago was saying it's under control, it'll go away on its own, everything's fine. is now declaring a national emergency on coronavirus, but it's the right thing to do. It's the right thing to do. If you're just joining us on YouTube, please make sure that you like the stream. Somehow we have 4,200 people watching and only 300 people have liked the stream. The likes really do help us bring in more viewers because YouTube is more likely to recommend well-liked streams. And also make sure to hit subscribe. We have been and will continue to. We're actually planning around large amounts of coverage around coronavirus. YouTube has told us they are going to be whitelisting us to monetize coronavirus content, which has been a big disincentive for a lot of independent media outlets, not us, to cover what's going on. So make sure you like and subscribe, and we're going to be following everything that's going on with this. We are decentralizing the production of the David Pakman Show just in an abundance of caution to keep everybody separate. I'll be producing the show at home. Pat will be editing, social media, ad sales. It's all going to be happening in a decentralized way because I don't want to even conceivably be contributing to the problem. And so starting Monday, that's the direction that we are going to be going in. Okay, let's see here. Joseph Vanskoy says Trump needs to shut up and let Dr. Anthony Fauci do the talking. Thus far, he seems to be the only one in the government that knows what he is doing. Yeah, the CDC Dr. Redfield, something like that. Embarrassing implosion yesterday or the day before questioning in Congress. Kevin Altschuler says the boobies must flow. Is this a thing? People are actually worried about some kind of holdup in porn production because of coronavirus? I have not heard that before. Thanks to David Garrett for grabbing an alpha membership. Ahmed Shausha says, I'd literally in the name. Oh, it's literally in the name, virus. Yeah. No, I think the idea is maybe they're wrong that the coronavirus is a virus, but they're not. Lada has a link to the worldometers.info. Yeah, I have that pulled up already. We'll look at all of the data here, and there's a lot to discuss, and worldometers.info is a good platform for it. Inconsolable says this is the most dangerous, damaging partisan hoax that I've ever seen. Well said. Netra Smith has grabbed a Soy Boy membership. Shaners says lack of testing will spread this like crazy. Arizona Department of Health standards still say testing only applies to known contact. Jay Harper says, do you really believe Biden can beat Trump? I believe depending on the economic circumstances in November, both Bernie and Biden could beat Trump. In every recent poll, Biden is doing better than Bernie against Trump, but we can look at that later if people want. For now, we are simply standing by for Donald Trump's press conference at the top of the hour, during which he is expected to declare coronavirus a national emergency. And hopefully that will really get people aware of what's going on. I think that's part of the problem because, for example, New York City, the MTA, the Metropolitan Transit Authority in New York City, today announced that there has been an 18% decline in ridership. And it's like, that's significant. That's almost 1 out of 5 people in a city, with 8 million people. But I don't know that mathematically 18% is enough, particularly when the people riding still are in very close proximity. I don't know that that's enough to really mathematically get us to an R that is below 1. So hopefully this declaration by Donald Trump, if anything, will get people really taking it seriously. I don't know. Okay, some guy says, I think we have plenty of porn out already. Amelia Terhune says, check out the report on chloroquine and zinc treatment. I want to be really careful, guys. There are people saying colloidal silver will, cure coronavirus. I don't want to be involved in any possible misinformation. So I want to be very careful. I don't know anything about that, and I'm glad to research it, and I will later, but I don't want to be a purveyor of disinformation in any way whatsoever. If you're just joining us on Twitch, I appreciate you joining us. Make sure to hit that follow button. We're almost at 30,000 Twitch followers. Monkeyville has grabbed a Prime subscription. Nix the Ladder says, thanks for all your hard work, David. DJ Gibster says, Ohioan here. Incredible that I may have the virus, yet can't get tested. Stay healthy. Yeah, there's a report out of Ohio from the public health officials there that they believe 1% of the population in Ohio, meaning 117 or so thousand people, have the virus right now. If that's the case, then we have a real mathematical problem in dealing with this. Okay. Kevin Altschuler says he's already watched all the porn, so he's worried about porn production under COVID. Okay. Dillinger Seatic says Governor Abbott declaring a public health disaster. Sam Dean says happy Friday the 13th, mate. You rock, Dave. Thank you. Appreciate you joining me. Let me say thank you and welcome to Leslie Goodman Malamuth. Leslie is new member number 8 at joinpacman.com. You can grab a membership. It's very quick, easy, and if you appreciate the work that we're doing, there's a super simple way to support it. We're talking about a couple bucks, literally. Joinpacman.com, and that coupon code 2020 now will save you 66%. Phylogeny says, even in South Korea with their mass screening and robust treatment quarantine that lower COVID-19 mortality, it's still many times higher than the flu and climbing fast, 0.84 as of today. I thought it was lower than 0.84. We can look at that data momentarily. I'm seeing South Korea 71. Oh, that is 0.84. You're right. You're absolutely right. They're at about 0.84. I believe that oftentimes 0.1 is thrown around as the flu death rate, but I believe more accurate is something like 0.148. So that's really like 0.15. That doesn't mean 0.84 is good. It just means it's not 8.5 times higher. It's only like 5 times higher. Looking for small wins here. And Italy's rate is, of course, very, very high. A very close friend of my dad's lives in a northern Italian city, and he came down with a cough and fever and vomiting a few days ago. Vomiting is not a common coronavirus symptom. I believe it's only 13% of cases. And he now has pneumonia, presumed to be coronavirus pneumonia, and has been admitted to the hospital. And we're worried about him. He's generally in good health, but he's close to 70, and it's not good. It's not good. Also, yeah, I know, by the way, guys, I am aware that you don't calculate the death rate by dividing deaths by cumulative cases. What you need to do is first, you need to take the death rate and divide it by the resolved cases, which include people that are recovered, right? Only once someone has recovered do you know that they're not going to die. And then you adjust that for the number of presumed unofficial cases, which is a question mark. The U.S. official count right now is 2,000. The real number in the U.S. could be anywhere from 5,000 to hundreds of thousands if Ohio's 1% number is to be believed. And we just don't know. We're working with incomplete information. All we can do is say, is there anything I can do to avoid catching this from someone? And is there anything I can do to avoid giving it to someone if I'm carrying it right now? The answer to both of those things is try to work from home, try to avoid being around other people. There's nothing else that we can do until such time that some kind of antiviral therapy and or vaccination is put together. We're just moments from Donald Trump speaking and declaring a national emergency. If you are joining me on YouTube, welcome. I would very much appreciate it if you do me this the very small favor of hitting the like button on our stream, as well as hitting the subscribe button. We will continue to cover all of these live coronavirus events, and we welcome your participation in them as well. And it really does a lot for our channel when people like the stream and subscribe when we do a stream. Very much appreciated. Okay. I see people saying that if I refresh, we are now over 2,000 cases in the U.S. I wouldn't be surprised. Yes, there we are. 2018 is the official number. But listen, folks, this number is outrageously low. Like yesterday, I tweeted that someone I know in the area had a fever and cough and was told, don't come in, we can't test you, and it's okay for you to go to work, which seems insane. I think that it's conceivable. I've had a slight cough for 10 days. It's possible I have the virus. I am self-quarantining. We just don't know. There's no way I'm going to get a test. There's zero chance that someone for example, it would be useful for people in my situation to know if we are carrying it. I don't know. So I'm just staying home. What can I do? Okay. Other messages coming in. Let me see here. Don't want to miss anybody. Joseph Jaramillo says, keep up the good work. Timmy Lunsford, David, what do you believe the best source for accurate info is on the pandemic? Big fan. Thanks for all you do. There's a couple different doctors that are very good. One is Dr. John Campbell, who is on YouTube. There's also on Twitter. I want to give you the name of this other doctor that I started following yesterday. Dr. Dina Grayson is very good as well. Okay. So I would, if I were you, I would check out the daily updates from Dr. John Campbell. I believe it's John, as well as the Twitter videos. She's been doing like 25-ish minute videos, Dr. Dina Grayson, and that's her Twitter handle as well. Dr. Dina, Dena Grayson, just like Alan Grayson. She's very good. She is a physician scientist and expert on Ebola and pandemics, and we're trying to get her on the program. Both are very, very good. Okay. Carpe Donnelly says, I understand the president is who should be reassuring the people, but he looked and sounded awful Wednesday night. Different messenger might be best. Yeah, I think that, honestly, I would put Dr. Anthony Fauci in charge of all communications on this, but it's not going to happen. Okay. Amelia Terhune says it's treatment used in malaria and autoimmune. Okay, I'm going to research that. Yeah, someone mentioned, if anybody can get me a scholarly article on chloroquine and zinc, I'm very willing to look at it. I do want to be careful that until I am comfortable about something, I would not want to say too much about it. Jackson Hanan says people spurning Biden are idiots who think that moving politics significantly to the left is some kind of loss for progressivism, despite the fact that the practical differences between Bernie and Biden are nullified by a Senate to the right of both. Jackson, I'm glad you're saying it, because if I say it, I get crushed. So you're thinking, okay? Zachary Snyder has grabbed a YouTube subscription. Thank you very much. Let me thank a couple of other people. Charles Floyd is new member number 9 at joinpacman.com. Charles, I really appreciate your support. You know, it's been inspiring, the number of people that have written to me over the last couple of days saying, David, you've been covering coronavirus for months when you had a lot of other people in your area. I don't want to say who, disregarding it as a hoax. You know, I've signed up for a membership, so on and so forth, because we want to support the work that you're doing. I really do appreciate that. And on that note, I really want to thank Charles Floyd for grabbing a subscription at joinpacman.com. Donald Trump running late, not surprising. The conference, the address on Wednesday night also was late, but we are standing by. We are also going to pay close attention to the stock market. Right now, plus 4% Donald Trump for the day. Donald Trump has not yet spoken, and we want to see where it goes. Every indication in my mind, ladies and gentlemen, that there could be significant volatility after Donald Trump speaks. I believe that this moment here was where this big decline, where we went from plus, where were we here? We were at plus, no, here we were at minus, well, this doesn't make, oh, I see. We were at minus 0.1. We went all the way down to minus 3. When I believe it was announced that Trump would be declaring the state of emergency. We will see what happens at the top of the hour. But yes, a lot of people's portfolios very, very, very messed up. People asking, okay, so listen, sometimes people ask me, David, you have an MBA in financial planning. Give me financial advice. I don't do that. Everybody's situation is different. How close you are to when you want to retire, your financial situation, all of these things are different. So I couldn't possibly give anyone financial advice. Or are people saying that this is, oh no, it's starting soon. People saying that this is starting later. I believe it's supposed to start any second. And the White House has also started the stream. So I believe it's about to start, unless it's gotten delayed. Does anybody know about that? We don't know. It was scheduled for 3 p.m. Eastern, which was 10 minutes ago. Okay, nobody knows. Okay, we're just going to stand by. Listen, here's what I'm doing. I'm betting on the fact that this is not the end of the United States economy. Okay, if I'm wrong about that, it's not going to matter what I do with my money. Okay, but assuming that this is not the end, I am considering this an opportunity to keep doing the buying of mutual funds and bonds in the asset allocation that I have been doing at a discount. It's very, what else can I do, right? I mean, I'm not going to panic sell. Typically, dividends don't decline drastically during downturns, if at all, which means that those dividends, while stocks are cheaper, will get you slightly more additional shares so that then when things eventually recover, you have more shares on which you can gain. That's what I'm doing. I'm not shorting. I'm not doing any of that stuff. That's my view. It's a long-term approach. For the last 15 years, I've been just accumulating shares in the asset allocation that makes sense to me. Period. That's all, and that's not advice for anybody in particular. Let me say thank you and welcome to Trevor Kodesh, who is new member number 10 today. Thank you, Trevor. Appreciate your support. Matthew Tremblay is new member number 11 today. I want to say thanks to Matthew as well. Very much appreciate your support at joinpacman.com. Yeah, I am not, I don't believe that I am smart enough to time the market, right? So, people say, dude, there's still plenty of time to short it or just sell and then buy back in lower. I don't think I'm smart enough to do that. I just don't. When I toyed with stocks when I was younger, rarely did that stuff work for me. I don't believe I'm smart enough to do that. So my goal is hold stocks for as long as possible. Every additional day I own a stock is an additional day on which I can accumulate a dividend on that stock. And when I buy, which I'm continuing to do, I'm doing it at lower prices. That's it. I don't have any, there's nothing special that I'm doing beyond that. Okay. Lance Powers says, David, what are the stakes for this speech? Can Trump salvage this? Oh, hold on a second. I had a big scroll there. I have no idea. I don't pretend to know what's going to happen after Donald Trump announces an emergency in just minutes from now. I started accumulating index funds when I was around 20. Okay. Skunk Games. Just wait until this hits a homeless population in a major city. Universal health care, anyone? Well, that's a case a lot of people are making, and it's a reasonable one. The dude says, relating to your story, the city of Bergamo in northern Italy is basically ground zero for coronavirus and has a funeral every 30 minutes. Yeah, that's, I didn't want to say, but that's where our friend is. He lives in Bergamo. D. Smitty says the province of Saskatchewan in Canada may have a tentative vaccine for the virus. Let me Google that. Saskatchewan coronavirus vaccine. All I'm seeing is that they got a grant to find a vaccine. I'm not seeing anything else right now, but if somebody has other articles, I plan to look into that. Yeah, I don't know. I don't have any other details on that as of yet. Zachary Snyder says, David, you should watch the Rogan episode with Michael Osterholm. I did, and I recommend that to people as well. Okay, so 3 recommendations to people right now if you want to get information from actual medical experts. Number 1, check out Dr. Dina Grayson on Twitter. Tell her David Pakman sent you if you follow her. I would appreciate that because we're trying to get her on the show. Number 2, check out Dr. John Campbell's YouTube channel. He's doing daily or twice daily updates. And number 3, check out the Michael Osterholm episode with Joe Rogan. Name withheld. Who do we believe, Trump or Trump? He says everything's fine, but is also declaring a state of emergency and maybe even martial law. No evidence yet that he is declaring martial law. Lawrence Burris has grabbed a YouTube subscription. Joseph Vanskoy says the fatality rate is likely around 1%, assuming a third of the people need hospitalization. Harvard model assumes infection of 75 to 150 million in the U.S., depending on intervention. Yes, indeed. That is exactly what I am reading. And I just missed a call from Sam Cedar. Sam Cedar. Interesting. I'm going to have to talk to him a little bit later. Excuse me, folks. News is breaking. Let me just tell Sam. Hold on. Hey, I'm streaming. Can I call you back? Something's going on with Sam Cedar. Who knows? And my phone just picked that up as well. Sam clearly needing to talk to me about something. And I don't think it would be appropriate for the live stream. Okay, Mohammed Pope says, what's your advice regarding going to the gym? Listen, I don't know. I had been going to the gym up until days ago, and I'm not going anymore, partially because I've had a little bit of a cough, and partially because it seems that it's just a ripe place for contagion. So I'm not going to the gym at this point in time. Scott White says chloroquine is a malaria treatment that has shown possible efficacy in SARS, COV2. See PubMed article, PubMed 320. Okay, very good. So we will Google that. I appreciate that very, very much. And we are just waiting here. PubMed.com. We have that. This is exactly the type of information that is useful. Very good. Okay, Aaron Bolio says, I've had a really bad cough for the last week. I'm 24, not worried, but trying to be careful around parents in their 60s. Yeah, I'm staying away from my parents. Payman Alemi and JKC have grabbed YouTube subscriptions. Name withheld says not to be morbid, but maybe Tulsi is taking all this into consideration. What if Biden and Bernie get the virus? She could be the default candidate. No comment, but you know, people clearly are aware of the demographic realities of this, of what's going on here. Let's see what Sam wanted. Oh yeah, sorry. Okay, yeah. So we don't know what Sam wants, but Sam needs something. Could Trump be stalling for the markets to close? I don't. That's an interesting question. If Trump can stall this speech until the market closes, maybe up 4% in only 43 minutes. Maybe whatever disastrous news he's about to deliver, including possibly the complete and total shutdown of, is Trump going to recommend all restaurants close? I mean, what Trump is going to announce whenever he speaks could potentially have a year or longer of impact on the economy. So it's possible that that's what Trump is doing. Cristobal Moreno has grabbed a YouTube subscription. Anthony McGarry says, why can't the right see Trump's constant lying? I don't know, but it's really, really bad. Let's see here. Okay, I want to thank a few people who signed up on my website. Tyler Dang has signed up and is new member number 12 at joinpacman.com. John-Luc Gutierrez is new member number 13. Scott Hilliard is new member number 14 at joinpacman.com. Justin Boley is new member number 15 today. Rudy Trujillo is new member number 16 today. And that's it. Really appreciate your support at joinpacman.com. We are 18 minutes past when Donald Trump was supposed to speak. I don't want to start searching around, but does anybody have any update as to what this delay has been caused by? Do we know what is causing this this delay, or do we not know? Let me see what's happening on PBS. PBS Trump coronavirus. Let's see. PBS Live. We don't have that here. Let's see. Live. Now I can't even find the live PBS stream. Does anybody know what's going on? Has this entire thing been canceled? Waiting for markets to close. He's busy making money. Yeah, we don't know. There's some kind of delay. It's not clear what's going on. I don't know. Chris Brown, what effect, if any, has the virus been shown to have on otherwise healthy young adults who vape regularly? I don't know anything about vaping, but so let me give you the vaping and smoking is an interesting question. Again, I'm being very, very careful. Oh, wait, somebody says that there's a live feed of the room. If somebody tells me where to find a live feed of the room in which they're going to give the remarks, I would pull that up. Other channels have audio, and NPR Twitter has a live feed. If someone can describe a YouTube channel that I can find, then I will pull that up. NBC News, NPR. Okay, let's try to find the NBC News one. Okay, NBC News, Trump coronavirus. Let's see here. Special report, here it is. Okay, all right, very good. So we'll keep it here, and this will let us know exactly when it's starting. Okay, listen, so early on, and again, I want to be really clear, I'm not an expert on this. I'm just reading about it, and when I see a trustworthy source, I tell you what I've read. Early on, Wuhan and Hubei province had a very high death rate, and there were way more men dying than women. Why was that? Okay. There is the idea that for cultural reasons, many more men smoke in China than women, and that this really is interacting with people with any kind of respiratory liability, including what smoking does to you. And that could explain why so many more men, and the death rate was higher for men than women early in China. Okay, that's one expert that suggested that. So I have been saying for years, I wouldn't be vaping, I wouldn't be smoking banana leaf, ingesting smoke. You know, when they say the term vapor, people think, oh, it's like steam, it's like water steam, it's like a steam bath. No, what vapor really means is aerosolized vaping chemicals. I wouldn't want that stuff in my lungs, and I wouldn't be doing it, and I wouldn't be surprised if young people who do vape are more at risk of developing complications. That's my advice, just based on what I've read. Rick Noonan sends a super chat. Clever to swear. Did Trump really clarify? Oops, sorry. Where was that one? Did Trump clarify his waiving off copays for coronavirus treatment statement? No, but some governors actually got insurance companies to make good on it. Gaudy Bag for Lee has grabbed a YouTube membership. SC John has subscribed. Phylogeny says chloroquine is an ionophore that increases intracellular zinc concentrations, and zinc inhibits SARS in vitro. It's being used in Korea with promising results, but there is yet no confirming double-blind testing. That is a very specific analysis, which I appreciate. Lady of the Lake, I called the doctor with the flu Monday. I'm in Washington. Was not asked where I live, where I caught it, or next step. I would have thought they'd be trying to gather data. The systems are failing us, sadly. A lot of these systems are not working well, and I wish that the situation was different. Welcome if you're just joining us on Twitch. You are a big part of what we are doing here, and you have been. I want to say thank you to Zamzabam for grabbing a Twitch Prime subscription and wants me to call Sam Cedar on stream. Rosape517 has subscribed with Prime. Laughing Virgil has subscribed with Prime. Ziffer has a subscription as well. I appreciate that. If you're just joining on YouTube, I really appreciate you being here. We are standing by for Donald Trump. I would really appreciate it if you're watching on YouTube, if you hit the like button and the subscribe button. These things are all free. We plan to continue bringing you all of what's going on with the virus and the expected national emergency. And you can really help us out just by hitting like and subscribe. It takes just a second, and it really does do a lot for our channel. That's not a joke. Okay. Let's see here. Zachary Snyder, if people don't know, they can help by installing foldingathome.org to donate their computer's idle resources to help research on the virus. Yeah, I'm familiar with that website. Toby Schweiger has grabbed a YouTube subscription. Clever to Swear says 2,600 were affected by coronavirus in Italy yesterday. Today is about 2,500. It is a decrease. We're all safe now. Great. We fixed it, guys. It's all good. Vicious RK, do you think getting a gun is a smart idea as part of preparation? If not, is there any point where it would be a good idea? I would be lying to you if I said, when I start thinking about, we don't even have a national emergency yet. People are buying all the toilet paper they can find. People are buying 50-pound bags of rice. I worry that there will be the potential for, I want to be careful, erratic behavior and decisions once a national emergency is declared. I don't know. I don't want to say anything. I don't want to give anybody any ideas. Let me put it that way. Captain Aiko says, can you shout out Benjamin Dixon? When will he be on the show next? Yes, Benjamin Dixon doing great work. Don't know when he will be on the show next. Travis Hyde says, check out Sam Harris's recent episodes as well on the virus. Cynthia Muniz and Broderick Aspling, as well as Cheryl Morrow, have grabbed YouTube subscriptions. Mike says it's weird in Austria. On one hand, you see people like this lady I saw at a store buying 100 kilograms of sugar. On the other hand, people say this is all BS. Much love from Europe. Be safe, D. We're trying. Brondo sends a super chat from Mexico. Clever to Swear says, you know how Italians kiss each other to greet? Yeah, I mean, so do Argentinians. I don't know what's going on in my birth country of Argentina. Jen's Flock says, what site are you using to follow COVID numbers? I'm mostly using worldometers.info, but there's this other platform, arcgis.com, which is pretty good and has a lot of other data. It's not all the same data. This is run by Johns Hopkins, and I was planning on looking at this with you guys after Trump speaks, but mostly I've been using worldometers. And I like how increasingly you can look at country by country. So we can look, for example, China's cases have drastically diminished thanks to their draconian measures. Oops, sorry, I clicked China again. If you look at Italy, on the other hand, you see that daily cases in Italy are going in the exact wrong direction. That's not good. In fact, that's very, very bad. If you look at South Korea is a country that has gotten this under control. You do see declining cases, although a little bit of a burst recently. So I find worldometers to be pretty good. Still standing by for Donald Trump, scheduled to speak 26 minutes ago. It is conceivable that he is actually going to wait all the way until the top of the hour to prevent whatever he is about to do, including presumably declaring a national emergency, to prevent it from immediately tanking the stock market. In that case, it will likely just tank on Monday, unless something happens in the interim to change that. I want to say thanks to a couple of other new members. Robert Boyd is new member number 17 today at joinpacman.com. Reed Steinmetz is new member number 18 at joinpacman.com. Manfredi Sequi is new member number 19 at joinpacman.com. Thanks to Benjamin Ledwell, you are subscriber number 20 today. Very much appreciate the support. And we are, I don't care if you use this coupon code, it saves you 66%. Support at any level is always very much appreciated. Okay. We are actually close to 10,000 live concurrent viewers on YouTube. We've never had that before, which is incredible. It's sad that it takes a national tragedy to do that, but I really appreciate the community that's been following our coverage of everything going on with coronavirus. We do currently have, across our 3 platforms, somewhere around 12,000 people in total who are watching, but we are incredibly getting dangerously close to 10,000 live viewers on YouTube, and we have never had that. So welcome to everybody. If you're new to the channel and you're wondering who the hell is that guy with the weird hair in the bottom right of the screen, this is the David Pakman Show YouTube channel, and I would love it if you liked our stream and also hit the subscribe button. These things cost nothing, and it's really a big deal for us, and I appreciate that you guys are all here. And there it is, 10,000 live concurrent viewers on YouTube. Incredible. And nothing like a tragedy, I guess, to bring people together. And we are just waiting here on Donald Trump. Andrew Sepp says, my local AMC canceled all showings just now. Listen, it sucks, but it's responsible. It's the responsible thing to do. Carolyn McGahey has subscribed on YouTube. Christopher Hellstrom, welcome. Ori Stewart says, vaccine in testing stages in Saskatchewan. Any thoughts? There's a bunch of vaccines that are in testing right now. There's, and that's good news. Although it's going to be a while still. Dan Hastert has grabbed a YouTube subscription. I appreciate that. Where did Dan Hastert go? There he is. S. Higgs says, Nick Fuentes on the show. You platform Tim Pool. Oh, my goodness. Get out of here. Arolis, it is an uncomfortable reality that a vote to Biden shows the DNC they are correct, but letting Trump win is unacceptable. Yeah, listen, I mean, we're not doing really like political, handicapping of races, but Joe Biden is going to, unless Joe Biden dies during the debate on Sunday, Joe Biden is going to so crush Bernie Sanders on Tuesday, assuming that none of those elections are postponed. He is Florida, Illinois looked like it might be a place Bernie had a shot. Biden's going to crush him. Ohio looked like it might be close. Biden's going to crush him. It's going to be crazy. The numbers are going to be crazy. I expect Joe Biden to be more than 2 million votes ahead by the end of Tuesday's elections. It's just the reality. I know people, it's like, I'm so past people getting mad at me for telling the truth. Looks like something's happening. Here comes Donald Trump, ladies and gentlemen. Here comes Donald Trump, and we will just watch it over here. We don't know what to expect. I would prefer that. Okay, here we go. What we are about to hear will tell us what is the next year of life in the United States going to be like.
Thank you very much, everyone. Thank you. Thank you.
I'll take notes.
Beautiful day in the Rose Garden. Appreciate everybody being here. Today I'd like to provide an update to the American people on several decisive new actions we're taking in our very vigilant effort to combat and ultimately defeat the
I've got it all the way up, guys. I'm sorry.
virus.
He sounds short
We've
of
been
breath.
working very hard on this. We've made tremendous progress. When you compare what we've done to other areas of the world, it's pretty incredible.
Let me get a louder
A lot of
feed,
that had
guys.
to
Give
do
me a
with
second.
the early designation and the closing of the borders. And as you know, Europe was just designated as the hotspot right now, and we closed that border a while ago. So that was lucky, or through talent, or through luck, call it whatever you want. But through a very collective action and shared sacrifice, national determination, we will overcome the threat of the virus. I also announced Wednesday night, following the advice of our medical professionals, who are doing a tremendous job, and we appreciate it very much, that we're suspending the entry of foreign nationals who have been to Europe in the last 14 days.
Watching stocks.
From entering the United States. Citizens, permanent residents, and our families, any of the families returning from Europe, will be subject to extra screening as well as self-isolation for a period of 14 days.
Trump sounds
As
sick.
the World Health Organization confirmed today, many of the things that what we said were 100% correct, including our designation before them of Europe. Like our earlier very aggressive actions with China, this measure will save countless lives. I appreciate a number of the folks behind me, number of the people behind me said that that saved a lot of lives, that early designation. But it is only the beginning of what we're really doing, and now we're in a different phase. We had some very old and obsolete rules that we had to live with. It worked under certain circumstances, but not under mass circumstances.
That's
They were
called
there for a
blaming
long
Obama.
time. They were in place for a long time, and we're breaking them down now. And they're very usable for certain instances, but not for this. To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency.
There it is.
Two very big words. The action I am taking will open up access to up to $50 billion of very important and a large amount of money for states and territories and localities in our shared fight against this disease. In furtherance of the order, I'm urging every state to set up emergency operation centers effective immediately. You're going to be hearing from some of the largest companies and greatest retailers and medical companies in the world. They're standing right behind me and inside of me. I'm also asking every hospital in this country to activate its emergency preparedness plan so that they can meet the needs of Americans everywhere. The hospitals are very engaged. New York and various other places are also very engaged. I just spoke with Governor Cuomo. We had a very good conversation, and we're working very strongly with many states, including New York. The emergency orders I'm issuing today will also confer broad new authority to the Secretary of Health and Human Services. The Secretary of HHS will be able to immediately waive provisions of applicable laws and regulations to give doctors, all hospitals, and healthcare providers maximum flexibility to respond to the virus and care for patients. This includes the following critical authorities: the ability to waive laws to enable telehealth, a fairly new and incredible thing that's happened in the not so distant past. I tell you, what they've done with telehealth is incredible.
It's incredible.
It gives remote doctors visits and hospital check-ins, the power to waive certain federal license requirements so that doctors from other states can provide services in states with the greatest need. Number two, the ability to waive requirements that critical access hospitals limit the number of beds to 25 and the length of stay to 96 hours. The ability to waive the requirements of a 3-day hospital stay prior to admission to a nursing home, big thing. the authority to waive the rules to hinder hospitals' ability to bring additional physicians on board or obtain needed office space. They can do as they want. They can do what they have to do. They know what they have to do. Now they don't have any problem getting it done. The authority to waive rules that severely restrict where hospitals can care for patients within the hospital itself, ensuring that the emergency capacity can be quickly established. We'll remove or eliminate every obstacle necessary to deliver our people the care that they need and that they're entitled to. No resource will be spared, nothing whatsoever. 10 days ago, I brought together the CEOs of commercial
10
labs
days ago, you said this was
at the
going
White
away.
House and directed them to immediately begin working on a solution to dramatically increase the availability of tests. Other countries have called us and worked with us, and they're doing similar things or will be
Dow
doing similar
continuing to
things.
crash.
As a result of that
Free
action
fall.
today, we're announcing a new partnership with private sector to vastly increase and accelerate our capacity to test for the coronavirus. We want to make sure that those who need a test can get a test very safely, quickly, and conveniently. But we don't want people to take a test if we feel that they shouldn't be doing it. And we don't want everyone running out and taking, only if you have certain symptoms. Using federal emergency authorities, the FDA approved a new test for the virus. We did this within hours after receiving the application from Roche, a process that would normally take weeks. We therefore expect up to 500,000 additional tests will be available early next week. We'll be announcing locations probably on Sunday night. I want to thank Roche, great company, for their incredible work. I'd also like to thank Thermo Fisher. The FDA's goal is to hopefully authorize the application within 24 hours. It'll go very quickly. It's going very quickly, which will bring additionally 1.4 million tests on board next week and 5 million within a month. I doubt we'll need anywhere near that.
Yeah.
At the same time, we've been in discussions
Those
with
are tough words to live
pharmacies
by.
and retailers to make drive-through tests available in the critical locations identified by public health professionals. The goal is for individuals to be able to drive up and be swabbed without having to leave your car. I want to thank Google. Google is helping to develop a website. It's going to be very quickly done, unlike websites of the past, to determine whether a test is warranted and to facilitate testing at a nearby convenient location. We have many, many locations behind us, by the way. We cover this country and large parts of the world, by the way. We're not going to be talking about the world right now, but we cover very, very
By the way, what does it mean some websites
strongly
take a
our
long time
country.
to build?
Stores in
Obamacare
virtually every
website?
location. Google has 1,700 engineers working on this right now. They've made tremendous progress. Our overriding goal is to stop the spread of the virus and to help all Americans who have been impacted by this. Again, we don't want everybody taking this test. It's totally unnecessary. And this will pass. This will pass through, and we're going to be even stronger for it. We've learned a lot.
He just pulled out some notes.
Tremendous amount has been learned. I want to thank Deborah Birx, and I want to ask her maybe to come up and say a few words as to what's happening. Dr. Birx is a highly respected person I've gotten to know very well over the last 6 days. And
Yeah, someone
what
who
we've
knows
done is
something, maybe
rebuilt
take a turn
something
at the
that
mic.
was very old-fashioned, somewhat obsolete, certainly obsolete when it comes to the kind of numbers that we're talking about. Dr. Birx, please.
Someone who knows something, say a little something. And everybody's speaking into
Thank
the
you,
same
Mr.
mic, of course.
President. It's a pleasure to be here with all of you. I think you know at the beginning of this epidemic, HHS through CDC proactively developed an assay built on the existing flu surveillance system. That surveillance system was then converted to diagnostic system.
Guys, I'm just going to
But
switch to a
a
safer
quality
stream.
platform that can meet the needs of the American public.
Oh, God, this one's too quiet.
Our current approach to testing was inadequate to meet the needs of the American public. He asked for an entire overhaul of the testing approach. He immediately called the private sector laboratories to the White House, as noted, and charged them with developing a high-throughput quality platform that can meet the needs of the American public. We are grateful to LabCorp and Quest for taking up the charge immediately after the meeting, and within 72 hours, bringing additional testing access, particularly to the outbreak areas of Washington State and California, and now across the country. We are also very grateful to the universities and large hospital systems that took up the charge to develop their own quality tests, made available by new FDA guidance. This has resulted in expanded testing across New York, California, Washington, Colorado, and you see sometimes those drive-through options that have been made available through these high-throughput options. Following the meeting last week, major commercial laboratory equipment and diagnostic companies took immediate action to adopt and develop new testing systems. Last night, the initial company, Roche, received FDA approval, moving from request to development to approval in record time. This innovative approach centered fully on unleashing the power of the private sector, focusing on providing convenient testing to hundreds of thousands of Americans within short turnaround times. In less than 2 weeks together, we have developed a solution that we believe will meet the future testing needs of Americans. I understand how difficult this has been. I was part of the HIV/AIDS response in the 80s. We knew from first finding cases in 1981, it took us to almost 1985 to have a test. It took us another 11 years to have effective therapy. It is because of the lessons learned from that we were able to mobilize and bring those individuals that were key to the HIV response to this response. I understand that a lot of this behind-the-scenes action over the last couple of weeks was invisible to the press and the American people. But this intense effort has not only—
Sorry, the volume is low. Let's go to the NBC feed.
Solutions, but an automated high-throughput system bringing the availability of these quality coronavirus testing to the American people at unprecedented speed. Finally, I want you to know in South Korea, they did have a large number of tests available over the last several weeks. Their positivity rate is between 3% and 4%. With LabCorp and Quest expanded testing, their positivity rate is between 1% and 2%. So we want to also announce this new approach to testing, which will start in the screening website up here, facilitated by Google, where clients and patients and people of interest can go, fill out a screening questionnaire, move down for symptoms or risk factors, yes. They would move down this and be told where the drive-through options would be for them to receive this test. The labs will then move to the high-throughput automated machines to be able to provide results in 24 to 36 hours.
That smirk on
That is
Pence's
the intent
face.
of this approach. We have seen it work just in our own United States, and we want to bring this across the continent. Thank you very much.
That's the right thing to do. It should have been done 6 weeks ago, right?
I'd like to maybe have Tony, do you want to come up? You've become I think everybody out here knows you pretty well, but Tony has been doing
he's
a
competent.
tremendous job, working long hours, and you've seen a lot happen, but this has been, it's been a great experience, and working with you has been terrific. Tony, please.
An actual doctor who knows things.
Thank you very much, Mr. President. This is an example of another example of what I've been referring to in my discussions with many of you in the audience as a proactive, leaning forward, aggressive, trying to stay ahead of the curve. And what you're seeing now with this order is that we're going to be able to remove the constraints so that people at the state, the local level, the individual physician, all the way up through the federal government will have as many constraints as possible removed for them to do everything they possibly can so that we can implement the things that we've been talking about. The containment, the mitigation, so that, as I've said many times, that curve that I refer to that goes up, we don't want to have that curve. We want to suppress it down to that small mound. And I think what we've done today is something that is going to be a very important element in having us be successful in doing that. We still have a long way to go. There will be many more cases, but we'll take care of that. And ultimately, as the president said, this will end But what's going on here today is going to help it to end sooner than it would have. Thank you.
Thank you very much, Tony. If I could, some of these folks we know, they're celebrities in their own right. They're the biggest business people, the greatest retailers
Oh, dear God.
anywhere in the world, and one of them is Doug McMillan from Walmart, and I'd like to have Doug, if you would, say a few words, wherever you may be. Good,
The Walmart CEO gets to speak?
When we
What?
got the call yesterday from the White House, we were eager to do our part to help serve the country. And given what we're facing, that's certainly important to do. We should all be doing that. So we've been asked to make portions of our parking lot available in select locations in the beginning and scaling over time as supply increases so that people can experience the drive-through experience that the President described. We'll stay involved and do everything we can from a supply chain point of view to be of assistance. Thank you, sir.
Thank you very much, Doug. Appreciate it very much. I'll just stay right over here. And Richard, if you could come up, please. Richard, please. Walgreens, thank you.
Yep. Thank you, Mr. President. And similar to Doug and Walmart, we're happy to stand in here and help in communities all across America, because a lot of times when we have natural disasters, our stores are a beacon in the community, and this situation is no different. So we look forward to partnering with the CDC, the administration, HHS, and the task force, and specifically to the Vice President's doing such a fantastic job. We're ready to engage and help. Thank you.
Thank you.
Nobody's shaking. Oh,
Thank
they
you
are
very
shaking
much.
hands. That's not a good idea. Jeez.
Brian Cornell, Target.
Everybody's shaking hands. Keep shaking it. Now Trump
Thank you,
passes
Brian.
it to him.
Thank
There
you,
you go.
please.
Now he's got it.
Well, Mr. President, thank you for inviting us here today, along with our colleagues from Walmart and Walgreens and our partners at CVS. Normally, you'd view us as competitors, but today we're focused on a common competitor, and that's defeating the spread of the coronavirus. And we look forward to working with the administration to do our fair share to alleviate this growing threat. So thank you for including us today. In the near term, we're all committed to making sure we're keeping our stores open to serve the American consumer who's rapidly stocking up on household essentials, key food and beverage items
Stocking up's
that they
an
need during
understatement.
this time, making sure we run safe stores and create an environment that's safe for our team members, making sure that they feel supported during this very critical time. So thank you for including us.
Thank you very much. Great job.
Okay, yeah.
Is Tom here? Tom Poland? Tom Poland, please.
Thank you, Mr. President. As CEO of Becton Dickinson, we're one of the leading providers of medical devices as well as collection products for testing of coronavirus. We're ramping up our manufacturing capacity to ensure that the right collection devices and testing equipment are ready to address this issue. Thank you, Mr.
Thank you
President.
very much, Tom. Great job you've done. Stephen
Everybody's doing great.
Rakowski,
Everybody's
Quest
doing great job.
Diagnostics, please. Great job. Thank you very
Thank you very much. Thank you, Mr. President. So as mentioned, we were called with the leadership of the Vice President last week to come together as an industry. And we took advantage of that opportunity to work with the FDA, to work with the Center for Disease Control. And we are up and running with tests in a number of our facilities. As the President mentioned, we now have capabilities from Roche Diagnostics that we will bring into our facilities this weekend. And I know myself and my colleague at LabCorp will be doing the same. So the capacity available to the American public to support this action with consumers will be considerably increased in the next few weeks. Thank you, Mr.
Thank you
President.
very much. I appreciate it. Thanks. And Matt Sauce, please, of Roche.
Sauce.
Matt, thank you, Matt.
Thank you, Mr. President. So from Roche, we want to thank the FDA for their rapid approval of our coronavirus test. We really appreciate the partnership with the CDC and the FDA to get that to market as fast as possible.
Market.
Because it's critical for us to make that available to help patients in need, and working with laboratories to get it up and going in the near future, which will bring hundreds of thousands of tests available to patients in need in the United States. So thank you.
And you can do it. You can do it. Great company. David Pierre of Signify Health, please. Thanks, David.
Thank you, Mr. President. We are the largest house call provider in the U.S., and we go to the homes of the most vulnerable elderly. And through our network and our logistics engine, we stand ready to help and provide our clinicians to be where they're needed, whether they're in retail clinics or in the home, and we're here to assist. Thank you very much.
Thank you very much. And we'll be changing a lot of the rules, regulations for future, should this happen in the future, which we hope it never does.
Trump
But it
coronavirus,
will,
sponsored by
yes,
Target,
somewhere out there.
Walmart.
Some bad ones
Walgreens.
over the years, and I guess that'll continue to an extent, but we hope it never happens. But we're going to be changing a lot of the old rules and specifications and regulations. Adam Schechter, who's really been of tremendous help. LabCorp, please. Adam.
Thank you, Mr. President. At LabCorp, we're working every second of every day to increase the number of tests that we can run. We're working with academic medical centers, with our colleagues at Quest, with other hospital and other laboratories to ensure that we do everything we can to increase the testing as we move forward. And I can tell you, we understand how important the testing is, and we are committed to doing everything possible.
Thank you very much. Great job. Thank you. Thomas Moriarty, CVS. We all know CVS.
Can't forget CVS.
Thank you, Thomas.
Thank you, Mr. President.
We're going two-ply all the way.
We have
at
been
CVS.
focused since the start of making sure our patients and the customers we serve have the information they need, the safety they need as well. We are committed to working with the administration and local public health officials to make this work as well. And thank you, sir, for the honor.
Are these advertisers? Like, what's going on?
And Bruce Greenstein, LHC Group, tremendously talented people. Thank you very much.
Mr. President, thank you for the honor of being here. And the home health industry has been treating patients and seniors in the safety and comfort of their own home for decades. We're very proud to be part of the equation for testing in their own home. For Americans that can't get to a test site or live in rural areas far away from a retail establishment, we're here to help and to partner with our hospitals and physicians, as well as the people we have here today that will be doing testing around the country. Thank you.
Thank you very much. Fantastic.
And, there you go.
Okay, I like that. That's good. We're also announcing the following emergency executive actions today. To help our students and their families, I've waived interest in all student loans held by federal government agencies, and that will be until further notice.
Oh, so we can
It's
afford
a big
that.
thing for a lot of students that are left in the middle right now. Many of those schools have been closed. Based on the price of oil, I've also instructed the Secretary of Energy to purchase, at a very good price, large quantities of crude oil for storage in the U.S. Strategic Reserve. We're going to fill it right up to the top, saving the American taxpayer billions and billions of dollars, helping our oil industry and making us even further toward that wonderful goal which we've achieved, which nobody thought was possible, of energy independence. It puts us in a position that's very strong, and we're buying it at the right price. And that's something that would have not even been possible a week ago. The price of oil went down quite a bit, so we're going to fill it up. There's a good time to fill it up. I'd like to ask Mike Pence to say a few words, please.
Oh, boy, that's not good.
VP.
Maybe lead us in prayer.
Thank you, Mr. President. It is, this day should be an inspiration to every American.
Oh, God.
Because thanks to your leadership from early on, not only are we bringing a whole of government approach to confronting the coronavirus,
Industry, too.
we're bringing an all of America approach. Mr. President, from early on, you took decisive action. You suspended all travel from China. You created travel advisories, South Korea and Italy. We screened all travelers from all airports in both of those countries.
That's a total
And
lie.
on the unanimous recommendation of your health experts, you, at midnight tonight, will effectively suspend all travel from Europe, and Americans that were returning will be screened and asked to voluntarily participate in a 14-day quarantine. Throughout this process, Mr. President, you put the health of America first, but you brought the best of America to address it. And it's not just at the federal level.
Wow.
As you said, Mr. President, we've been working with states across
This
the
guy
country.
doesn't
We
believe a
issued
word of
broad
it.
guidelines from CDC for every American. But this week, at your direction, we tailored specific recommendations from CDC for New York, Washington State, California, Massachusetts, and Florida. And we've been
Trump's
in continuous
recommendation.
contact, as you said, with governors around the country. And Mr. President, you have forged a seamless partnership with every state and every territory in this country to put the health of our nation first.
Can you imagine?
But today, I trust that people around the country that are looking on at this extraordinary public and private partnership to address the issue of testing with particular inspiration. After you tapped me to lead the White House Corona Task Force, Mr. President, you said, this is all hands on deck. And you directed us to immediately reach out to the American business sector, commercial labs, to meet what we knew then would be the need for testing across the spectrum. And today, with this historic public-private partnership, we have laid the foundation to meet that need.
I've never seen anything
For
like
Americans
this.
looking on, by this Sunday evening, we'll be able to give specific guidance on when the website will be available. You can go to the website, as the President said. You'll type in your symptoms and be given direction whether or not a test is indicated. And then at the same website, you'll be directed to one of these incredible companies that are going to give a little bit of their parking lot so that people can come by and do a drive-by test. And Mr. President, I want to join you in thanking Walmart and CVS and Target and Walgreens. These are companies that are synonymous with communities large and small, where people come together, and now they're going to come together to meet the needs of the American public. These commercial laboratories, LabCorp and Quest and Roche, have just done an incredible job stepping forward, and they're going to literally make
a ton of money,
hundreds of thousands of tests available and being processed with results to patients in the very near future. But it's all a result of you tasking us with bringing together
godlike,
not just government resources, which all state labs can now test across the country. CDC is testing. But you said, Mr. President, that we wanted to bring all the resources of the country together, and that's what this partnership really means. You know, the truth is that we have coronavirus cases now in 46 American states. And while the risk of serious illness of the coronavirus remains low, we want to encourage every American to practice common sense, practice good hygiene, go to the CDC's website to see what the guidance is for your community or for the American people broadly. And as the President has said, it's especially important now that we look after senior citizens with chronic underlying health conditions. Last week, the President directed the Center for Medicaid and Medicare Services to raise the standards at our nursing homes, increase inspections at our nursing homes. And today we're offering very specific guidance, which Seema Verma will articulate about visitations at nursing homes. It's important to remember that they were there for us when we were growing up, Mr. President.
This is crazy.
They helped us with our homework. They tucked us in at night. They cheered us on.
Fauci's getting uncomfortable and just folding his arms
in
now.
our careers. And now it's time for us to be there for them and to recognize that seniors with chronic health conditions are the most vulnerable, and Americans can make a difference. So wash your hands, use common sense, look after the most vulnerable. And Mr. President, I know I join you in saying that every American should be proud.
Why is Fauci even near Trump? He's 80 years old.
Private partnership that's going to be speeding access of testing to
Whoa,
millions
look at this pop
of
right
Americans
here.
in the weeks
hit
ahead.
8%
And
up?
together, as you've said many times, together we'll get through this. Together we'll put the health of America first.
Thank you. Seema, where's Seema? I'd like you
Look
to
at the
maybe,
Dow. It's just a buy
take
frenzy.
that a step further, please.
Oh, and now it's declining
Thank
again.
you. Well, thank you to the President for the declaration. It allows my agency, CMS, that runs Medicare and Medicaid and has oversight of all of the nation's healthcare facilities, to suspend regulations that could get in the way of treating patients during this time. These temporary national blanket waivers are reserved for the rarest of circumstances, and they represent a massive mobilization of our country's resources to combat this terrible virus. And the flexibilities we are offering will be a godsend to the providers, clinicians, and facilities on the front lines of this fight.
Trump looks gigantic.
And later, CMS is going to be issuing guidance directing nursing homes to temporarily restrict all visitors and non-essential personnel, with a few exceptions such as end-of-life situations. We fully appreciate that this measure represents a severe trial for residents of nursing homes and those who love them, but we are doing what we must to protect our vulnerable elderly. Thank you.
Look at the market. It's up, down. It's crazy
I
what's
said
going
in
on.
my address to the nation the other night, all Americans have a role to play in defeating this virus.
Up it goes again.
Our most effective weapon right now is to limit the damage to our people and our country.
9%.
And slow the spread of the virus itself. The choice we make, the precautions we put into place are critical to overcoming the virus, reducing its spread and shortening the duration of the pandemic, which is what it is. The CDC has published guidelines on
Now he admits it.
coronavirus.gov to enable its coronavirus.gov.
Gov.
And it's very heavily used right now, I will say, to enable every American to respond to this epidemic and to protect themselves, their families, and their communities.
And there it
While
is.
the
Stop
risks
close.
to young and healthy Americans remains very low. We've learned a lot about this over the last 2 weeks.
Wow.
Anyone can be a carrier for the virus and risk transmission to older Americans and those with underlying health conditions and those who are most at risk. They have not done very well. Older Americans who are, especially if they have a health problem, they have not done well. We must take all precautions and be responsible for the actions that we take and that we see other people take.
What a day.
We want to prevent the spread and transmission of the disease. It's incredible what's happening with the sporting world, where
Sports.
so many of the great sports that we've gotten so used to at this time of the year, they're not going to be meeting, and they've done a great service, actually. But that would be another way that it could be, problems could be caused. But this is why I outlined on Wednesday night my administration's the fact that we've issued a requirement suspending all medically unnecessary visits to various places, but in particular nursing homes. We should all be working off the same playbook when it comes to protecting Americans. We have to.
Kind of like
we need to be consistent in
off.
adopting measures to limit the spread of the virus. The virus is the same whether it's spreading in cities, towns, or rural communities. The tools and tactics for attacking it are similar no matter where you go. No matter where you go. You have some hot spots throughout the world right now that people would have never thought possible. And they're being very seriously affected. Key among these efforts are breaking chains of transmission between people. These measures have been adopted by many companies, universities, and schools. And we want to protect the safety and the health of their employees and their students. I encourage everyone to follow the guidelines we've issued by CDC and these common sense measures. A lot of it's common sense.
Right.
For the areas where the virus is spreading, the CDC is advising communities to postpone large gatherings, postpone assemblies, social functions and sporting events, stagger recess and lunch for schools that aren't canceled, limit in-person meetings, increase scheduled cleanings, and cancel work-sponsored travel, among numerous other steps that can be taken. Americans are the strongest and most resilient people on earth, and in the coming weeks, we will all have to make changes and sacrifices, but these short-term sacrifices will produce long-term gain. And again, I've said we're learning a lot for the future, and future problems like this, or worse.
It's getting
or
weird,
worse,
guys.
could get worse. The next 8 weeks are critical. We can learn, and we will turn a corner on this virus. Some of the doctors say it will wash through, it will flow through, in interesting terms, and very accurate. I think you're going to find in a number of weeks it's going to be a very accurate term. In times of hardship, the true character of America always shines through. We live in the company of the greatest heroes and the most inspiring citizens anywhere in the world. We want to take care of our people. We want to draw on the strength of our history, draw on the strength of our people, and we will get through this all together. We will just get through it. So much progress has already been made.
How inspiring.
And frankly, the numbers, because of steps that have been taken, are at a level that a lot of people are surprised.
No one's surprised.
Especially when
Surprised
you
at how
compare
bad
them
it is.
with other places with far smaller populations. The spirit and the will of our nation is unbreakable. We will defeat this threat when America is tested. America rises to the occasion. And to those families and citizens who are worried and concerned for themselves and their loved ones, I want you to know that your federal government will unleash every authority, resource, and tool at its disposal
The government
to
I ran
safeguard
on
the lives and
destroying
health of our people.
will save you.
So we're with you every step of the way. No nation is more prepared or more equipped to face down this crisis. As you know, we are rated #1 in the world, we're also helping other nations.
We're rated #1.
Many other nations, we're helping them a lot. And they're doing okay in some cases. In some cases, they're not doing well at all. But we're working with a lot of groups of people and a lot of other nations. With faith and heart and hope and love and determination, we will succeed, we will prevail, we will be very, very successful, and we'll learn for the future. Thank
We're
you all very
#1.
much. If you have any questions, we can take some. Go ahead, John, please. And if you'd like to ask some of the folks up here, would be fine, please.
Sure. Mr. President, where are you with the House bill? Yesterday we talked to you in the Oval Office. You were opposed to it. What has happened since then, and what's the holdup on that?
Well, we just don't think they're giving enough. We don't think the Democrats are giving enough. We're negotiating. We thought we had something, but all of a sudden they didn't agree to certain things that they agreed to. So we could have something, but we don't think they're giving enough. They're not doing what's right for the country.
And if I could ask Dr. Fauci?
Go ahead, please.
Thank you, Mr. President. You just mentioned waiving interest for student loans.
Yeah.
You talked about buying oil from the SPR or adding to the SPR. What other specific targeted measures is your administration thinking about taking? The Treasury Secretary Steve Mnuchin said today that you're just in the second inning of things that you might be undergoing.
That's true, and we are looking at many different things, as you know. You know some of them, they've been written about very widely, but we're going to be releasing a paper in about 2 hours stating quite a few other steps.
It's going to
very
be
important
a lot of
ones.
paper.
Please, go ahead.
Paper will be clean.
Please, go ahead.
Thank you so much, Mr. President. I want to know if you are in contact with the Brazilian President Bolsonaro after a member of his delegation who was with you Saturday was tested positive. And also, I want to ask another question, if you let me. Senators Lindsey Graham and also Senator Rick Scott are self-isolating. Are you planning to take any kind of precautionary measure to protect you and also your staff who was there with him?
We have no symptoms whatsoever. And we had a great meeting with the president of Brazil, Bolsonaro, great guy.
Whatever his name is.
Very tremendous. He's doing a fantastic job for Brazil.
Oh, yeah.
And as you know, he tested negative, meaning nothing wrong this
Well, he
morning.
tested
And
positive,
we got that
then
word
negative.
too. Because we did have dinner with him. We were sitting next to each other for a long period of time.
We shared frogs'
But
legs.
are you in contact with him over the coronavirus crisis?
We're talking about it country to country, but we did discuss if he had a problem. It was reported that he may have it, and he doesn't, fortunately.
So much, Mr. President. Dr. Fauci said earlier this week that the lag in testing was, in fact, a failing. Do you take responsibility for that?
No.
And when can you guarantee that every single American who needs a test will be able to have a test? What's the date of that?
Now.
Yeah, no, I don't take responsibility at all because we were given a set of circumstances, and we were given rules, regulations, and specifications from a different time. Wasn't meant for this kind of an event with the kind of numbers that we're talking about. And what we've done is redesigned it very quickly with the help of the people behind me. And we're now in very, very strong shape. I think we'll be announcing, as I said, Sunday night. And this will start very quickly, and we'll have the ability to do in the millions.
Give us 2 days,
over
then
a very,
we'll
very
tell you
quick
the
period
plan.
of time. So no, and what we have done, and we are going to be leaving a very indelible print for the future in case something like this happens again. But it was and that's not the fault of anybody. And frankly, the old system worked very well for smaller numbers, much smaller numbers, but not for these kind of numbers. Tony, maybe you'd like to say something.
Will you have,
Tony,
yes, please, by Sunday night, will every American be able to get a test?
So just to reiterate what I said to many of you multiple times, it's a dissonance of a system. The system was not designed for what it was designed for. It worked very well. The CDC designed a good system. If you want to get the kind of blanket testing and availability that anybody can get it, or you could even do surveillance to find out what the penetrance is, you have to embrace the private sector. And this is exactly what you're seeing, because you can't do it without it. So when I said that, I meant the system was not designed for what we need. Now, looking forward, the system will take care of it.
Right.
And Mr. President,
And
with respect,
interestingly, if you go back, please, if you go back to the swine flu, it was nothing like this. They didn't do testing like this, and actually they lost approximately 14,000 people, and they didn't do the testing. They started thinking about testing when it was far too late. What we've done, and one of the reasons I think people are respecting what we've done it very early. We've gotten it very early, and we've also kept a lot of people out.
Mr. President,
yes,
the
please,
last administration
please.
said that they had tested 1 million people at this point. You've been
Well, ask them
president
how
for
they did with
3
the
years.
swine flu. It was a disaster.
But with respect, you've been
Next,
president
please.
for 3
Different
years.
disease, of course.
They had a very big failure with swine flu, a very big failure.
President, I want to ask you about the European travel ban that goes into effect at midnight tonight and the exemption that you've offered to the UK. There are 17 countries that are in the so-called Schengen zone that have fewer coronavirus cases than the UK. And just in the past 24 hours, the UK has added 208 coronavirus cases to their total. Why do they, Mr. President, deserve an exemption?
Well, because
and
I have
would you
resorts
consider
there.
adding them to this travel ban list?
Well, that was recommended to me by a group of professionals, and we are looking at it based on the new numbers that are coming out, and we may have to include them in the list of countries that we will, you could say, ban or whatever it is during this period of time.
We're gonna ban
But yeah, the
countries.
numbers have gone up fairly precipitously over the last 24 hours, so we may be adding that. And we may be adding a couple of others, and we may frankly start thinking about taking some off.
Ooh.
Go ahead.
Thank you, Mr. President. I'm a correspondent with Hong Kong Phoenix TV. You have mentioned that the number in China has been decreasing, and China has made tremendous progress in the past weeks.
True.
I'm wondering how much confidence does this give you to control the virus in the United States? And do you see the data China has been sharing with the United States has been helpful?
I think it has been helpful. We've been working very much with China. I've spoken, as you know, with President Xi.
China.
They went through hell, and their numbers are starting to look very good. They're really looking very good. We're very happy about that. We are sharing data, yes. In fact, we're sharing quite a bit of data, including the fact that some of our pharmaceutical companies are working over there right now with large groups of people.
Data.
Yeah, go ahead, please.
Thank you, Mr. President. You spoke with Canadian Prime Minister Trudeau yesterday.
Yes.
Did you discuss the potential closing of the border between Canada and the U.S.? And by extension, are you considering ways to salvage the $2 billion daily trade between the two countries?
So we didn't discuss the border. We've had a very good relationship, just about finished with the U.S.
By the way, guys, everybody's spitting onto that same mic getting passed around.
I think that was the primary reason for the call. At the time, his wife had not been diagnosed, and she's a lovely lady, wonderful lady, great lady. And
Very
since then,
attractive.
I've
I'm sure he
heard,
finds her very
read that the result was that she has it. And I was a little surprised. I think he was surprised also. We did discuss it prior to. She's going to be fine, but he thought that she would not most likely have the virus. Unfortunately, she does. But we didn't discuss the border yesterday, no. Go ahead, please. If you have any questions for these great geniuses up here, you should, even a business question related to what we're talking about.
Mr. President, Ross Palumbo from ABC News Miami. As a relatively new Floridian, what is your message today to the cruise line industry and the travel industry that Florida depends upon? And since Senator Rick Scott and Miami-Dade Mayor Carlos Jimenez have the same exposure as you, and they are self-isolating,
Why are
what's
you not?
your message to them that they shouldn't be?
Well, I don't know that I had exposure, but I don't have any of the symptoms. And we do have a White House doctor, and I should say many White House doctors, frankly. And I asked them that same question, and they said, you don't have any symptoms whatsoever. And we don't want people without symptoms to go and do the test. The test is not insignificant. As far as the cruise line business, we're with them all the way. It's a great business. It's a great U.S. business, frankly. And I know how important they are to the country. That includes airlines, but the cruise line business obviously was hit very hard. We had a tremendous success out in Oakland where we moved it. Vice President Pence did a fantastic job with that. We worked with UK, we worked with Canada. They took their people back in Canada. It was approximately 600 people. UK likewise took a large number of people back to the United Kingdom. and we have people quarantined. It was a big operation, and it worked out really. You don't hear about it anymore. It worked out
great.
really well. Mike, you may even want to say something about that, because that was really done properly.
Well, thank you, Mr. President. And that program with the Grand Princess, the ship, is continuing to be administered in the highest standards, orderly way, as the President directed. And Americans that needed treatment have received them. I spoke to the governor of Iowa today, and some of those who now have been cleared are able, in proper supervision, to be returning to Iowa. They're making arrangements for them to do that. Others in Texas, others in Georgia. Again, it's another example of the extraordinary cooperation. Governor Abbott, Governor Gavin Newsom, Governor Brian Kemp of Georgia. But to add to that, the President directed me last Saturday to travel down to Miami. We met with all the leaders of the cruise line industry.
Great fun, went to the beach.
Several cruise lines have announced a 60-day pause in operations. Our Department of Homeland Security has praised them for doing that because of the unique health challenges, particularly presented to seniors with underlying conditions. We have a proposal from the cruise line industry, but they're currently considering what other steps that they might take, perhaps even similar to what those other lines have taken. We're anticipating some response on that in the next 24 hours. But as the President said, the American people cherish our cruise line industry, the men and women who work on the ships, the men and women who work on the shore, all the economies that are so benefited by a vibrant cruise line industry. And what the President's directed us to do is whether there is a pause in the moment, as some cruise lines are doing, and as we all continue to discuss, we want to work with the cruise line industry to ensure that when we come through this, that cruise lines and the medical services that are available and for the passengers and all of the crew, that cruise lines are safer than ever before and can prosper for many years to come.
Trump's going to cruise soon.
Go ahead, please.
This question is for Doctors Fauci and Birx. Dr. Fauci, based on what you currently know, what is the trajectory for when this outbreak will peak? How long will the American people have to remain on this emergency footing? And for Dr. Birx, as the administration tries to get its arms around this test kit shortage issue, the next glaring need could be respirators and related hospital equipment. So what is the administration doing right now to ramp up production of respirators
Great question.
and that kind of equipment should this outbreak persist?
So when you have an outbreak like this, particularly if you're trying to interfere with it, it's really impossible to predict the time element of when it's going to peak and when it's naturally going to go down. So if you look at the situation where countries really did not get to the point of trying to contain and mitigate very well, you see a peak over several weeks and then down again over other several weeks. What we're trying to do with the efforts that we're doing is to blunt that peak. And I mentioned it many times, and I think it's important and appropriate for me to mention it again because it answers your question. When you talk about preventing infections from without in, which is the kind of travel restrictions we're talking about, then how do you handle what you already have in your country?
Yes.
You continue some sort of containment, but you also do mitigation. And you try to proportion it to the areas where there are the most infections. The success of that and how much you make this turn into this is going to give you the amount of time. If we're successful, it'll be less. If we're not successful, it's going to be more. But these kind of things generally run out in a few months. Hopefully, we'll make it several weeks, 8, 9, whatever weeks. But I can't give you a number because it depends on how successful we are.
Great, thank you. It's a great question, and Dr. Fauci and I have worked together a very long time and continue. It's a privilege to work with him every day. So I think you can learn and I appreciate there were some graphics done by some of the reporting over the last several days. If you align the data from China with the data with South Korea, you can start to see almost a complete overlay of that data. And so that's what we're tracking very closely, as well as Italy. But you have an excellent question. I just want to make one note. In South Korea, I want to repeat, only 4% of the tests were positive. That means 96% of the people had a different respiratory disease, because we're in the middle of flu season, cold season, and all of the other respiratory diseases that we get every day. In LabCorp and Quest early data, they're running about 1% to 2% positive. That means that we have a lot more other respiratory disease out there besides the coronavirus, and that's why the screening is critical. But even with the screening, we're going to run what we think are very low rates. Needless to say, though, we're taking it extraordinarily seriously to plan for what could come. Not what Dr. Fauci talked about, blunting the curve. That makes it much less high need at that peak of the curve that we're all planning for. So we're in full inventory of all of our assets by the president unlocking and this emergency order and the Secretary of HHS's ability. It unlocks all of those stockpiles, those needs, what the VA has, what the DOD has, what the National Guard has, and what every hospital has. And the hospital emergency preparedness plan allows them to defer elective issues to keep those hospital beds open for those who might need it. So we're in full planning mode for each of those things.
And I might add that we are in the process, and in some cases have already done it, ordered a large number of respirators just in case. We hope we don't need them, but we've ordered a large number. Yeah, go ahead, please.
Thank you very much, Mr. President. In your speech to the nation, you mentioned the situation in China and South Korea have improved, and you're thinking about remove the restrictions, also the warning in place right now. When can we expect that announcement, and how do you see the overall progress that Asian countries made?
Well, some are making progress, some are not, as you know, but some are making progress. And as they make progress, as they get down to the number that we all think is right, that they know is right, we know is right, we'll be opening it up. And some are really moving along rapidly. We hope to be able to open things up as quickly as possible.
A little early to talk about dates, I think.
President. I'd like to ask Secretary Azar and Dr. Fauci just how Dr. Fauci, okay?
Right, better,
all right.
better. Not 100%, but 90%.
Right.
Go ahead.
This affects the elderly primarily, and in that sense, it's an unusual disease. Is
Love to
any
see
specific
masks at the press
research being
conference.
done as to why it affects our senior citizens more than others?
So I don't mean to diminish your question, but we already know why it would affect senior citizens more. Because when you talk about anything that requires a robust immune system, as you get older, your immune system is not as potent as it is when you were young. And that's the reason why when you talk about even influenza, which we have extraordinary experience with over decades and decades, the people who are very vulnerable are the elderly and those with underlying conditions. The same thing holds true for a variety of other disease. Why cancer is more prevalent in mostly in older individuals, because the immune system that screens for it is less robust. So it really is something that is kind of well known over a lot of studies.
Okay. OAN.
One of the questions was to Azar.
OAN.
Mr.
Oh my
President,
God.
so the
They're worse than
Chinese
Fox.
officials are expressing some tones of discontent with how where the source of this virus has come from, and they're spinning some odd narratives. What are your response to the Chinese
These are the
officials
crazy.
who
This
are
is
doing
crazier
that?
than Fox. OAN.
And have they signaled any kind of resistance to upcoming trade talks in response to
She
how
barely
we're
even knows what
handling
she's
this
talking about.
We have our
virus?
deal with China. They're going to be buying $250 billion worth of goods and $50 billion from our farmers, and it's a great deal for our country. It's about time somebody did that. And frankly, phase 2 will start negotiating. I did read one article, but I don't think that article was representative, certainly not in my conversations with President Xi. And they know where it came from. We all know where it came from.
Thank you, Mr. President. Yamiche Alcindor from PBS
Yes.
NewsHour. my first question is, you said that you don't take responsibility, but you did disband the White House Pandemic Office, and the officials that were working in that office left this administration abruptly. So what responsibility do you take to that? And the officials that worked in that office said that the White House lost valuable time because that office was disbanded. What do you make of that?
Love it.
Well, I just think it's a nasty question, because what we've done is, and Tony has said numerous times that we've saved thousands of lives because of the quick closing. And when you say me, I didn't do it. We have a group of people. I could ask perhaps my administration, but I could perhaps ask Tony about that, because I don't know anything about it. I mean, you say we did that. I don't know anything about it.
You don't know about the reorganization that happened at the National Security
It's the administration.
Council.
Perhaps they do that. You know, people let people go. You used to be with a different newspaper than you are now. You know, things like that happen.
But this was
Please go ahead.
That is a lunatic.
We're doing a great
folks.
job. Let me tell you, these professionals behind me and these great, incredible doctors and business people, the best in the world, and I can say that, whether it's retailers or labs or anything you want to say, these are the best in the world. We're doing a great job.
That is weaponized.
We have 40 people right now, 40. Compare that with other countries that have many, many times that amount. And one of the reasons we have 40 and others have, and again, that number's going up, just so you understand. And a number of cases, which are very small, relatively speaking, it's going up. But we've done a great job because we acted quickly, we acted early. And there's nothing we could have done that was better than closing our borders to highly infected areas. Please go ahead.
Thank you, Mr. President. Vanessa Yaklich for NTN24 for all Latin American countries,
Yes, sure.
and also for Spain, La Razón and Antena 3. I would like to ask you two very brief questions. One, for how long we're going to have the emergency, the national emergency?
I hope not long, but it's there now, and it gives tremendous powers for things that we need. Tremendous power, actually. And the Stafford Act and various other things that we're involved with and have studied and memorized in so many different ways and forms. It gives the kind of power that we need to get rid of this virus. And we're
Guys, he
going to
doesn't
do it
know
very
anything.
quickly. And I hope
Stop
we won't
asking
need it
questions.
very long, but whatever it takes.
So for now, we still don't know for how long. And something very important I wanted to ask you is, like, how do you really think it's essential coordinating with other countries and learning from their lessons that they already suffer the same situation? Countries, of course, like China and South Korea, but now recently Italy and Spain.
Well,
and
Italy's
how is that coordination done? Thank you so much, Mr.
We're in touch with Italy, and
Everybody talk at once.
It's a country that we love. We have tremendous millions and millions of people, origins from Italy, and we're working with them. They're in a very they're in,
people from Italy,
probably relatively speaking, the toughest position of all. We're in touch with everybody. We're in touch with, when I say everybody, we're in touch with many of the countries that you know about, that you're writing about, and they're calling us asking for advice. They're asking for the advice of the people behind me. Italy's got a tough situation, but they're really
Great
they
people.
have really clamped down, and I think they're going to see some very good results. It's tough what they did. They really took their medicine, but they're going to see some much better results. Yeah, Jeff?
Thank you, sir. With regard to domestic travel, should Americans feel safe, or should Americans at all be traveling to states such as Washington State, New York, and other hotspots within this country? And a follow-up on Brazil. You're asking people who come back from Europe, Americans who are coming back from Europe, to self-quarantine for a couple weeks. You were in a picture with somebody who now has coronavirus from Brazil at Mar-a-Lago. How is that different?
Well, I'll tell you, first of all, I'm not coming back from someplace.
But you were exposed.
There was somebody that they say has it. I have no idea who he is, but I take pictures, and
Isn't it like the
lasts for
Secretary of State or
literally
something?
seconds. I don't know the gentleman that we're talking about. I have no idea who he is. I haven't seen the picture. I
God.
said there's a picture of somebody, but I take sometimes hundreds of pictures a day. And that night I was taking hundreds of pictures, so
Oh
I
my
just
God.
don't know. Now, I did sit with the president for probably 2 hours, but he's tested negative, so that's good.
It's just a matter
Please
of...
go ahead.
And the domestic travel, sir?
Yep, cut
Go
him
ahead,
off.
please. I would say if you stay home, it's not bad. It's not bad. Now, there are certain parts of the country that are essentially have zero problem. Washington's been very tough, in particular a nursing home. But Washington, the state of Washington, has been very tough. It's been a big percentage of,
Dude,
when
they're
you
asking
talk
about
about the
your
40 deaths, it's
picture
been a
with the
big
guy.
percentage of the deaths, as you know very well. And they all came from a certain area, unfortunately. Please, go ahead. Go ahead. Okay.
Thank you very much,
Yes.
Mr. President. Cordelia Lynch, Sky News. You talked this week about the UK doing a good job in tackling coronavirus.
Not anymore.
In light of the rise in cases, are you changing your mind about that? You also just spoke about possible travel restrictions. Have you discussed when they might be put in place?
Well, in light of the results, as we discussed before, in light of the results, we're going to be looking at it. And I know the task force is looking at it very strongly. Vice President,
very, very
everybody. It was looking good, but the results have been building up pretty rapidly. So we'll be taking another look at that. Yes, absolutely.
Probably
ahead,
time
please.
to wrap, right?
Mr. President, thank you. I want to first follow up on Jeff's question because the person you were standing next to, whether you know who he is or not,
Right.
tested positive for coronavirus. Dr. Fauci said this morning, if you stand next to somebody who tested positive, you should self-isolate and get a test. You say your White House doctor is telling you something different. Who should Americans listen to?
Right.
And my second question
I think they
is,
have to listen to their doctors. And I think they shouldn't be jumping to get the test unless it's necessary.
So they
but I
shouldn't
think
listen
they
to
have to
Fauci?
listen to their doctors. And I mean, I don't know I haven't seen the picture. Somebody said there's a picture with somebody taking a picture with me, but I haven't seen it.
well, doctors have
but
said
I
you
can
might
tell
have
you,
it
Seeing
even
it
if you
doesn't
don't
matter,
have
though.
symptoms. Are you
Well-
being selfish by not getting tested and potentially
well, I didn't say I
exposing-
wasn't going to be tested.
Are you going to be?
Most likely, yeah.
Oh.
Most
When do you
likely.
think
Not for
that'll
that
happen?
reason, but because I think I will do it anyway.
Just for fun.
Will you let us know
Fairly
the
soon. We're
results?
working on that. We're working out a schedule.
My second question, Mr.
You go
President,
ahead,
that was
please.
a follow-up.
Go ahead.
Yeah, you're not going to get too far with that. Oh, my goodness.
I know there's been a lot of talk about testing. I just want to make sure we're clear, though, because we've been hearing from doctors who say, as of today, they still can't get patients tested who need a test. So as of today, can everyone who a doctor
crying?
wants to have tested get tested? And if not, when?
Well,
When
that's
will
been true
doctors
for a
have-
while, but I'll let Mike. Why don't you answer that, Mike? Please?
Yeah. He wants to leave this lie to Pence.
Well, as the president said, and Dr. Fauci has articulated, the nature of our current system where the CDC has samples sent and tests are performed, or state labs perform tests, or in some cases university and hospital labs perform tests, is generally adequate for an infectious disease or for people getting a diagnostic work done. But given the sheer scale of this, the president tasked us with bringing together this extraordinary public and private partnership. Today, by some estimates, when you add all the labs together, and today the president made it possible for every state in the country and their state labs to authorize labs across their state to do coronavirus testing. We're estimating somewhere between 15 and 20,000 tests a day are able to be performed. But very soon,
So deceptive.
with the program that was announced today, Americans will be able to visit one of the sites closest to them, as described on the website, if they're symptomatic, if the questionnaire...
Just a quick note, guys, because he's just lying. We know the lie. The language of the number of tests that could be done per day is a vague thing just about the number of tests that exist within our borders. If you actually go and you say to a testing center, how many tests is your maximum capacity based on what you have and how long they take? Very often the number's like 20. Okay, so that's what matters.
Authorized lab can contact the state lab. Again, every state lab in the country can perform tests today. But what the president charged us with,
the deception,
when I was tasked to take over the White House Coronavirus Task Force, was open up tests all across the country. The president said a few days ago that we made it clear that any American that wanted to get a test would be able clinically to get a test. Because I literally heard from the governor of Washington State who said the doctors in Washington State were saying that if you were only mildly symptomatic, they would not order a test. And fortunately, the president directed CDC to clarify that.
What?
Now, anyone in consultation with their physician, regardless of their symptoms, can request a test. And their doctors will contact those agencies, those labs in their state. But very soon...
And when they do, they're being told we're not doing the test.
These these drive-in sites and be able to obtain and participate in a test.
Fauci's
Burks,
body
is
language
to
is the
amplify that?
language of someone who knows Pence is
I
lying.
think that's perfectly said. I think just to review once more time about the testing, with LabCorp and Quest, I think many of you have been to doctor's office and seen the little boxes outside. What they do is they deliver both the specimen collection piece, because remember, it's a nasal swab. It's not a tube of blood. So they've delivered that to doctors' offices and hospitals, and then they will arrange to pick that up. The important piece in this all is they've gone from a machine that may have a lower throughput to the potential to have automated extraction. I know you don't want all these details, but it's really key for the laboratory people. It's an automated extraction of the RNA that then runs in an automated way on the machine with no one touching it, and the result comes out of the other end. So sample to machine to results. That cuts out a lot of the manual pieces that were happening that were delaying the test results.
And so with that, what's the timeline like from when you're tested to when you get results? Like next week, what should people expect?
Well, with the prior testing, it was taking several days because the test is slower. We believe with this test, because of its throughput, that the testing can be from start, remember it has to transport, to the laboratory that will run it. And then we're hoping that all can be finished within 24 hours, which is very similar to other tests that you received today. These are not point-of-care tests. We are working on point-of-care tests, but we have to realize point-of-care tests take 6 months or more to develop. So we're not waiting for those. We're still diagnosing this on nucleic acid. So it's an antibody. This is actually the antigen, the actual virus in your nose that we're amplifying.
Wow.
I think you have to remember, though, we're working very closely with states, and so you have a smaller form and more targeted form of government going in and
I would
doing
wrap
it,
if I were
like
Trump.
in New York, where the relationship is very good, like Gavin Newsom, where he made some very complimentary, that's California, he made some really complimentary comments the other day about how we're working together. We worked on the ship together, but we worked on a lot of other things together having to do with this. And we're really, the relationship that we have, I can't think of a bad relationship. We're helping them. We're funding them in some cases, depending on what it is you're talking about. And we're all working together very closely. So we've done really, I think, a tremendous job of teamwork
Trump thinks
with the
it's done
different states. All right, one or two more. And if you have questions for these folks, does anybody have a question for the folks up here? Who has a question up here? You have? Okay, go ahead. If you have a question, go ahead.
Thank you. I have one for you as well.
I thought. I know
no, but
you
I do have one for them because I haven't heard this
I was waiting
yet.
for that. Go ahead.
Because I haven't heard this yet.
Ask them first, please.
Yes, I will. Okay, with regards to the CEOs, can you please tell us when you expect to see items like hand sanitizer that have been going out of stock very quickly back on the shelves?
And gouging.
There have been a lot of reports about that. And for you, Mr. President, could you talk about a potential bailout for the cruise industry? You had suggested that could happen. Is that something you're still looking at, and how much would that be?
Well, I didn't suggest that it could happen, but I can tell you it's an industry that was very badly impacted by what's going on with the virus. And it's a great industry. It's a very important industry, and we will be helping them, and we will be helping the airline industry if we have to, assuming we have to. So far, people haven't been asking, but if they should be asking, we want to make sure our airline is very strong. And then one day, all of a sudden, wasn't looking so good. Interestingly, I was talking to Doug, and the numbers they're doing from the retailing standpoint, I guess because of this, your business is like the opposite. All of you you've been selling a lot of stuff. Do you want to answer the question as to the hand sanitizers?
Sure. Yeah, specifically, the areas where we're seeing pressure in the supply chain are surface cleaners, cleaning supplies, paper goods in particular. Hand sanitizer is going to be very difficult to have 100% in stock on for some time. We're still replenishing it and shipping it, but as soon as it hits the stores, it's going. The same thing's true for the categories I just mentioned. So all the retailers will be working hand in hand with the suppliers to bring that to the market as fast as we can.
What is your advice, though, for Americans who are seeking those items? What is your advice? They're selling out online. They're selling out in the stores.
I think this team has given you other examples of what people can do to fight back against this virus, and you should look at the entire list.
What? Oh my God! Basically saying you're screwed.
I mean, Obviously, it sounds very simplistic, but wash your hands as often as you possibly can. And I know you're not always in a position to be able to wash your hands, but wash them as much as you can. If you don't have the alcohol wipes, try and get them. If you can't get them, just try as best as possible to do it. I mean, you got to do the best you can.
Well, no, just general preparedness. You know, you want to wash your hands. You want to keep distance from people. And if you're around
Hey
someone...
guys, I tweeted about how crazy it is that One America News is allowed at these things, and One America News and their anchors are going bonkers on me on Twitter right now. You should go see what's going on.
Not an effective protection against getting the coronavirus. They're selling out. But the soap and water, hot water, soap, 20 seconds. That's how you do it.
Okay, one more. Go ahead.
Last question.
Go ahead. No, over here, behind you. Behind you.
Thank you very much, Mr. President. You have a great team, of course.
That's true.
My question is, Mr. President, are you happy from the Chinese response? What correctly really told you what really happened those days? And second, Prime Minister Modi or India have closed borders until April 15th, if you have spoken with the Prime Minister of India and if they have needed any help. And finally, sir, any message for the small businesses because they are losing some businesses because of this? Thank you, sir.
I like this guy's hair better
small
than Trump.
businesses, the Small Business Administration is now stacked with money to help them, and we're going to make the money readily available if they need it, small businesses. We had a great time in India. It was an incredible 2 days, and he's a great friend of mine, and he's a friend of his people because he was greeted incredibly warmly, as was I, in that stadium. It was an incredible event, and I loved being with him, so just say hello to him. But we talked about everything. We talked about far more than just borders. And as far as President Xi, likewise, he's a friend of mine. I believe that we are dealing in good faith, that we just worked as you know, and as I just said, we just worked an incredible deal, big deal, one of the biggest deals ever made of any kind. Big even by the standards of some of the people here, the deal with China. But I think that they want to get to the bottom of things also. We're working, our drug companies, our pharmaceutical companies are working very closely with China and with India, as you know, and with all over the world. And they're all over the world. These are magnificent companies that are very, very knowledgeable. And we're very lucky to have them because I think you're going to come up with, whether it's therapeutic or whether it's just help in getting better, and then ultimately a vaccine, which takes a little bit longer because of the test periods and a couple of other reasons. You're going to have it very quickly because of the great knowledge, and they'll have it very quickly. They've made a tremendous amount of progress. Thank you all very much. We appreciate it. Thank you. Thank you very much.
All right, before you guys leave, especially if you're watching on YouTube, please do hit like and subscribe on your way out. Just smash I want that like and subscribe button destroyed on your way out. I know a lot of people will be tuning out now, but we do really depend on people who just come on by. Whether or not you're trolling, either way, we do always suggest like and subscribe because it really does help us. Okay, so a lot of things going on here, obviously, and I mean, listen, the takeaway from listening to the letter of what Donald Trump said is that he's doing everything great. Everybody else is terrible. He couldn't possibly have done anything any sooner, any better, any more competently in any way whatsoever. Anybody who wants a test can get one. Everything is free. Everything's available. Wash your hands, and this will be over in about 2 weeks. Maybe somebody can actually clip that. That would be a good maybe thing to post. Okay, let me say thank you to a whole bunch of different people. Big Luna has grabbed a Twitch Prime sub. At Least a Little has subscribed. Disillusioned has subscribed. Tammy Nguyen and Zombie GX, as well as Volspace and R Dodds, Hob Cirque and Setitov. Designer Drugs is a new subscriber. Super Scope, Zamzabam. All of these people have just signed up, and they are all very, very good people. Let me say thanks to new members. I think we might be at 25. New member number 21 is Thomas Randa at joinpacman.com. Chad Johnston is new member number 22. Sean Brentlinger is new member number 23. Corey Potter is new member number 24. Yaroslav Lagunenko is new member number 25 today. And Brad Faulkner is new member number 26. If you have been enjoying, to the extent that any of us can enjoy, coverage of a tragic pandemic, which the government is woefully mishandling, but if you've appreciated the coverage, I think is better said, do consider grabbing a subscription at joinpacman.com. That also underwrites live streams of debates like we will have on Sunday evening with Bernard Sanders and Joseph R. Biden Jr. It underwrites the live election results, which we will have on Tuesday evening, so on and so forth. Okay. All right, let's see here. Super chats that have been coming in. So many have come in. I'm going to try to get to some of them here. Casey Bates says, I love listening to this and laughing, and then also looking up and seeing David chuckling in dismay. Like and subscribe, viewers. Thank you. Phonique the Second says, wrote you an article on Twitter. Please look for it. All right, my Twitter has imploded. Something insane has happened on Twitter. Usually I can't use my normal mentions feed because it's too crazy. So I go over and look at the verified one. The verified one is too crazy to even know what's going on. Also, hilariously, I tweeted that there was something weird about so many companies seemingly underwriting this coronavirus crisis, and some kind of like retail lobbyist wrote to me about how great it is. It's crazy what's going on Twitter. Okay. Any Ghost says, damn, this dude throws Fauci, the only dude making these idiots look halfway competent, under the bus that quick. Who threw him under the bus? Was it Trump who threw him under the bus? Imagine says, ammo is better than money. Waffles Giraffles says, U.S. missed the critical phase. Virus will steamroll. Everyone just calm down says, sorry, I can't take anymore. Thanks for streaming. Nunya Business says, HFS, that must have been one hell of a P-tape. Not Brandon says, didn't South Korea take care of their virus problem back in late December? They got on that real fast. Brumal H says, now to lead us in prayer, close personal friend of mine, great guy, Mr. Ronald McDonald. Yeah, I was expecting the McDonald's CEO to say they were going to have hand sanitizer inside of Happy Meals or something. Jeremiah complaining about losing brain cells during the conference. Sam Dean points out the pronunciations address, industry. The guy can't combine any basic level of valid understanding of pronunciation. Australia's still on board, but dude. Serial No YM63. Did they have all those corporations up there to positively influence the stock market? Maybe. And the stock market exploding in the last few minutes, as we saw. Look at that. Just incredible. And we suspected this was sort of the goal. Really, really, really stunning stuff. C-SPAN also, of course, ran the press conference, and it was all very, very crazy. Joe Krockenberg asking universal income until it's time over. A lot of people talking about that. Leica asking, could they manipulate the Dow somehow? Well, not somehow. They did it in exactly the way that you saw. Squashy Lemur says every one of them is probably infected now. Very, very probable. Tam I Am said, unbelievable. WTF is going on. This is an advertisement. Joseph Vanskoy, boy, I guess a pandemic is to big pharma as war is to military contractors. Cockroaches always find a way to profit in times of crisis. Sam Dean says, this is amazing. I've never seen anything like this. Oh, you just said it just as I was. Wow. But seriously, what is your greatest fear throughout this? My greatest fear is that we do not control this, that people don't take it seriously enough, that people keep doing all the things they normally do. We don't get it contained soon enough, and we don't get antivirals that work and a vaccine, and 150 million Americans get it. That's the concern. Thanks to Ramekin Beast for grabbing a Twitch Prime subscription, as well as Garnat or Gamut 90 and Big Luna as well. Thank you very much. Any Ghost says it was very quick, but when asked who the hell fired all those CDC people, Trump basically mumbled, I didn't do nothing. I don't know. What about Fauci? Yeah, I guess that is the way it went. Carrie Pink Mollinator makes me smile says, I'm in the UK under isolation. America is lagging here. Thanks, David, for live. Yeah, it's bad. Creamstar, has Trump ever taken responsibility for any failure? Okay, let me just briefly get to a couple of the other things I wanted to point out. I do want to thank Evan Berg. Evan Berg is new member number 27 today at joinpacman.com. Okay, a couple things to go through very quickly. The cumulative number of cases right now is 145,000, 5,400 deaths, 70,000 recovered. The number of active cases, which is, the number of active vectors, is officially 59,000. But remember, Ohio's public health officials said we probably have 117,000 people with it. If that's the case, none of these numbers are even remotely close. In terms of countries, China does continue to keep clearing roughly 800 to 1,000 cases. They have, around 20 to 40 new cases per day, and several, 1,000 people or so recover each day. So as you can see, the number of new cases in China dropping very, very dramatically because of the very strict methods they've put in place. Italy is an absolute mess. Italy continues to climb. I mentioned at the top of the stream, a close friend of my family, who I've known since I was a little kid, currently has suspected coronavirus pneumonia. He's in his mid to late 60s, and he is in hospital. And new cases daily in Italy. Very, very bad. Iran is also really in trouble. And Iran may be the only place that had a worse response than the US, or equally bad. And it's not looking good in Iran. South Korea widely does have this very much under control. As you can see, the number of new cases diminishing pretty significantly since March 3rd. Now, what we really need to know is, from the point at which more drastic measures are put in, how long does it take until you see the decline? So the decline sort of started on March 3rd. How long before that did the extraordinary methods go into place? You will also notice, and this is merely observational, if you look at the death rates in Germany, 8 over 3,600, Switzerland, 11 over 1,100, that's 1%, Norway, 1 out of 1,000, that's 0.1%, Sweden, Netherlands, Denmark, and UK, the death rates are extraordinarily low. We don't yet know whether it's simply early and there are more recent infections and the death rates are going to go up, or if they are actually handling treatment in a better way. We just don't know, okay? Moving on. Worst case estimate for U.S. coronavirus deaths. The numbers that now are being suggested by a bunch of different teams, the worst case scenario would be 160 million to 214 million infections. That's one projection. It could be a period of months or even a year, with infections concentrated in shorter periods, and as many as 200,000 or 1.7 million people could die. That's sort of the worst case that we've seen so far for the United States. This is another dashboard that I encourage people to take a look at. It has some advantages over the worldometers.info and some disadvantages. I do like that you can not only look at confirmed cases cumulatively, but also active cases. And when you look at China, for example, you see that the cumulative case bubble is much larger than the active case. This helps to understand confirmed, cumulative confirmed tells us who has had the most cases. Active tells us what places are the biggest vectors for contagion right now. Again, another estimate, this one, 150 million Americans could get coronavirus. The top end estimate would be 214 million as of right now. And again, these are worst case scenarios that are meant to shock people. They are meant to get people to say, I have to think about my behavior and I need to adjust it. A lot of problems in a lot of different places where people are just mobbing grocery stores, Trader Joe's, Targets, etc. The pictures are ugly. It's crazy what is going on. And again, stuff like toilet paper, there's, as far as I know, and correct me if I'm wrong, there is no reason to think that there will be a shortage of the toilet paper production flow, supply chain, unless people go and stockpile toilet paper, which people are doing. Again, so I don't really understand that, you know. Empty shelves everywhere. We're seeing this everywhere. People buying, 50-pound bags of rice. Look at the size of this Cheerio box. This is a Costco after all. So I am concerned about this because of the panic breeds panic. People hear about people buying stuff, so then they go and buy stuff. And, what I've done is I've slowly accumulated some non-perishable. So if I wasn't able to go to the grocery store for a couple of weeks, I'd be able to make, what did I get? I basically got a bunch of different types of pasta, rice, and various legumes, lentils, etc. Those last for a while. I got a bunch of broths, chicken broth, vegetable broth, etc. And I got a bunch of frozen vegetables. So if need be, and some frozen bread. If need be, I make some soups. They've got vegetables in them. They've got protein from the lentils or whatever else. I can make soups, and then I got some pasta sauces as well as a variety of different types of pasta. But I'm not actually using any of that stuff. I'm trying to sort of do my normal grocery shopping, and I've got a couple of weeks. That seems reasonable to me at this point in time. A lot of Trader Joe's images coming in. Bill de Blasio having to fight false rumors about quarantines. Okay. Interesting article in The Atlantic. This is a political story. I don't want to get into it now, but I would recommend people just look at this. Frozen bread, there's freezer bagels, and also I get like Ezekiel bread and just put it in the freezer. And then you can, you take 2 slices out, you put it in the oven or a toaster if you have one. I haven't had a toaster for 10 years. I just use the oven. It does take a while, but it's okay. You just put 2 slices in the oven, 10 minutes, you're good. The presidential power, the declaring an emergency thing, we shouldn't, I'm not being conspiratorial, but we shouldn't ignore. Thanks for gifting all those subs, by the way. We shouldn't ignore that there is a wide scope of presidential emergency powers when a national emergency has been declared. We should just be aware of it. I encourage you to read this article by The Atlantic. We already talked, if you're just joining us, there is the idea that remdesivir is an antiviral which is being used with some early success in South Korea. It was originally developed, I believe, by an Israeli company for Ebola. It didn't work well for Ebola. There's the idea that it or a modified version of it could be used to make many more COVID-19 cases more mild, significantly less serious. The ethical questions around should we do the full animal testing on vaccines? Are we in a situation where we need to more quickly move on to human testing? It's a medical ethics debate. I'm not weighing in on it. I'm merely telling you that this is another thing that is now being discussed, period. And then lastly, Donald Trump mentioning coronavirus.org. That is this website. And the website, let's even refresh it. It may have been updated since the speech was given. The website actually is barely working now. Too many people are accessing it, and it looks like it is not functioning. I'm unable to refresh, and it seems as though the website is functionally not working at this point in time due to the number of people trying to access it. But coronavirus.org has been established. That's basically everything that we know so far, and all of the new information that we have. Okay, a couple of other questions coming in. Chloe Callahan asked, did they mention the cost of the test? They did not. Brondo says, anyone notice how Trump's energy picked up after the OANN chick asked questions? Couldn't blame her. Gave her the same look he gives to Ivanka. That's brutal. Thanks to Lance Cooper and Brondo for grabbing YouTube subscriptions. Chris says, David, there are Bernie people watching this who still won't vote for Biden. Elderly or sacrificial lambs for apathy. Okay, I'm not going to dig into that now, but we have talked about that before. We do have a hype train happening on Twitch, and that's always very exciting. So consider participating if you are aware of that. And that's basically the scope of it. My plan so I don't know if people heard this at the beginning of the stream. YouTube has been flatly demonetizing all coronavirus content. We've been notified that we are being added to a list of authoritative opinion channels on coronavirus and whitelisted, meaning that going forward, we will be able to monetize our coronavirus content. And this is not like, as I said before, this isn't about trying to make money from a tragedy. It's we want to keep reporting on it. We'd be doing it either way. And it's a good thing that we are not being wrapped in with conspiracy websites telling you to go and buy colloidal silver and start drinking it, as some lunatic Christian channels have been suggesting. So that is good news. But the schedule as of now is if there are more announcements, like they said, maybe Sunday night, there would be announcements about more protocols. We will cover them. We will cover the Sunday night debate between Bernie Sanders and Joseph R. Biden Jr. And then we will cover results on Tuesday, Florida, and a number of other states voting. So that is our plan at this point in time. There were a couple other things, that we were going to look at over here. Let's look at case statistics. This is the worldometers.info website, and I wanted to go through this a little bit. Okay, so when we talk about the death rate, people have already talked about this. You can't just divide deaths by cumulative cases, because that does not give you an accurate number. The right way to calculate the death rate is you start with this. Of the cases with an outcome, if someone is currently sick, what are we dividing by? We don't know if that's a death or not. So you have to divide deaths by total cases with an outcome. When you do that, the numbers are ugly, right? Because it's 7%. What you have to add to that is the likely sort of off the record cases that have not been confirmed via testing. When you do that, obviously the death rate is a fraction of this. We don't know whether it's 0.4, 0.8, 1, 2. We just don't know. And when you have incomplete data, it's hard to get an actual death rate. That's one thing. Number two, one of the things that's important to look at is the rate of new cases, because there will come a time, hopefully, where we will see fewer new cases per day. But of course, the cumulative number of cases is going to go up. You're going to look at it and it'll say 150,000 cases. And you look the next day and it'll say 155. That won't tell you the daily new cases. Right now, the numbers are going in a very bad direction, as you can see. At some point, we would hope that the number of new cases will start to decline. And eventually you get to something which is effectively R less than 1, meaning each person is infecting on average fewer than 1 people. And on average, you are clearing cases more quickly than you get new cases. So we are going to see positive new case numbers for a very, very long time. It could be months. But what we are looking for is an inflection point at which daily new cases start to decline. And it's actually the real example of it. Let me pull it up. Is what happened in China. When you look at China, if you sort by total cumulative cases, China is at the top. If you sort by total deaths, China is at the top. If you sort by active cases, China is no longer at the top. The number of active cases in China is now smaller than the number in Italy, because China hit that inflection point. They hit it seemingly on February 12th. There was also a change in measurement or something that happened on February 12th that made this number artificially high. But that's the inflection point that we are looking at. Arguably, the inflection point even happened earlier on February 4th. But as you can see, that was 5-6 weeks ago. So this is going to take some time. The growth factor is that number that I was talking about. And as you can see, when the growth factor is under 1, that's good. That is, if you have a growth factor under 1, eventually you get to 0. If you have a growth factor over 1, of course, that is an expansion. 1.15 would be, or 1.59 would be a 59% increase over the, well, a growth factor of 1.59 means people are on average infecting 1 or 2 other people, weighted towards 2, because we're at 1.59. That's what that means. Cases excluding mainland China obviously going up dramatically. 8,000 new ones yesterday, and 7,000 the day before, and 5 the day before. As you see, the numbers are climbing. That's not good. Oh, and here's that math I was just doing. Yeah, 8,372. So that's a very, very bad curve, and it could continue. That growth factor outside of mainland China, somewhere recently, roughly between 1 and 1.5. So that's I think that's mostly everything that we were going to be looking at there. Let me say thank you to Az Bardi, who is new member number 28 today. Very much appreciate that. I also want to say thanks to everybody who has grabbed YouTube subscriptions, sent super chats, signed up on Twitch, etc. That's going to do it for today. We will continue following what's going on with coronavirus. Live stream of the Democratic debate on Sunday night, and also on Tuesday night, live election results, assuming none of those get postponed, starting at 8 p.m. Eastern time.